Hindi, linawin lang natin. Bigyan nyo lang kami ng listahan ng mga COVID patients na inyong binayaran sa mga ospital up to April 15.
Yes, Mr. Chair.
Yes. And secondly, starting April 15, nagkaroon na kayo ng case rate.
Yes, Mr. Chair.
Yung bang case rate nyo sa COVID, makikita na sa website ng PhilHealth?
Yes, Mr. Chair.
Makikita na. And what is the highest amount?
700,000 plus po for critical pneumonia.
And because of this COVID, lumabas na ang inyong policy regarding IRM.
Mr. Chair, the IRM policy po has been there since noon po may Yolanda, Marawi.
We know that.
Opo.
We know that, Yolanda. We know that about Marawi. Pero ang lagi inyong sinasabi sa inyong IRM will be the circular 2020-017. Tama ba?
07 po.
07.
Opo, because that time po,
No, wag na, okay na lang yun.
Okay, sir.
Doon tayo sa circular 2020-007. Okay. Number one, that is a circular. That is the one appearing in your website.
yes, Mr. Chair.
And as far as I can recall, that circular was signed by General Morales.
Yes, Mr. Chair.
Okay. Prior to the issuance of that circular, was there a board resolution o wala? We'll ask Director Padua. Bago ilabas ang circular dated 2020-007 ni General Morales, meron bang pag-uusap ang board for the issuance of this circular?
Sir, during that time when we were talking about IRM, the board, based on my perspective, approved the application for IRM basically because of President Duterte's proclamation number
Ano ko, simple
92.
lamang. Nandito na yung PhilHealth Circular number 2020-007. Ang tanong ko lamang, bago ba i-issue itong circular na to, was there a previous agreement or endorsement coming from the Board of Directors of PhilHealth?
Ma'am, yes. Yes, please.
Kasi meron pala po silang pinaratify noong 31 March 2020 for the IRM to all healthcare facilities nationwide given this COVID-19 pandemic at that time because wala pang pattern of geographical distribution ang
So,
COVID.
simple lamang tayo. Sabi mo, Mr. Chairman, the ratification was made on March 31. Ano ang niratify noong March 31?
Yung application for IRM po.
Yung application for IRM. Kailan unang-unang nagbigay ng IRM ang PhilHealth to any health facility? When was the first time? Dr. Vargas?
Mr. Chair, I'm referring to our finance.
Ano ko lamang, ang sinasabi ni Director Padua, ratification. E alam natin yung ratification, it is already after the act, not prior. Sa madaling sabi, nung i-issue ang circular, walang previous board meeting. Tama ba yon?
Sir, meron na pala akong, can I trace already once and for all yung history nitong IRM? Kasi parang,
Ano?
I read it, I got
Huwag
it.
na nating i-trace ang history kasi babalik pa tayo sa Yolanda, babalik pa tayo sa Marawi, babalik pa tayo sa Taal Volcano.
Ito na lang po, yung the first one po.
What date?
Oo. The first was on 30 January, kasi ni-record ko po to, sa akin nasa notes ko po, Your Honor. The first was on 30 January 2020, when the PhilHealth Board approved the immediate payment of 50% of all the pending good claims in the province of Batangas to alleviate the burden experienced by PhilHealth members and healthcare providers by reason of the said natural
Okay.
calamity. Mapunta na po ako sa
Teka
second.
muna. PhilHealth approved the payment.
Opo.
So it is not an advance payment. There was already a claim. Kasi itong sinasabi
Kaya
natin,
nga po, ito po kasi, sabi ko nga, I just want to read the chronology of events para malaman nyo po. Okay. So, the PhilHealth Board included IRM among the special privileges that may be conferred to healthcare institutions and PhilHealth members during unforeseen events and emergencies on matters such as membership, accreditation, and benefit payment. Such inclusion will enable
well, I am
management...
very much satisfied. Ha?
Okay.
Thank
Now,
you
the
for your
second na
time.
po. You
Ha?
want to go to the second na po eh.
No, I'll just make an inquiry. Okay. Mr. Senior Vice President? Okay. Sinasabi ni Director Padua, meron ng IRM as early as January 2007.
Honorable Barsaga, if you don't mind,
2007.
nasa IRM na po tayo.
Ha?
Nasa IRM na po tayo. Wala na po tayo sa...
Okay.
Nasa case rate po. Wala na po tayo sa case rate. Ang ibig sabihin po, lumagpas na po kayo na you already went to the IRM issue.
The case rate arising from the IRM.
Okay. Yes. Can
Okay, I'll just reserve my question regarding IRM.
Yes.
So that makapag tanong yung mga susunod sa aking mga kinatawan.
So, okay, thank you so much, Honorable Barsaga, for that. Malinaw po yung mga katanungan na nabanggit ninyo. We now proceed to, well, this is according to age. So, the older one is the Honorable Marcoleta is now recognized. Honorable Marcoleta?
Mr. Chair?
Mr. Chair,
Yes, before the Honorable Marcoleta, yes, Mr. SBP, Dr. Vargas.
Yes, Mr. Chair, for Congressman po, yes, sir, we require the chest x-ray.
Again.
We require po the chest x-ray.
They require the chest x-ray. Chest x-ray for the case of pneumonia. Okay, Honorable Marcoleta is recognized. Proceed.
Mr. Chair, mas matanda po sa akin ang dihamak si Congressman Barsaga. Naririnig po niyo? Mr. Chair,
Go ahead.
malakas na po ba o hindi pa rin?
Okay po, Honorable Marcoleta, we can hear you very clearly.
Mr. Chair, kasi kung naalala ninyo, nung nakaraan nagkaroon tayo ng pagdinig. Naggumawa po ng commitment si President Morales. Narinig naman ninyo yon na ito sanang pagtitipon na ito, pagdinig. Dapat nasa plenary siya sapagkat ako nangako ako na kapag pupunta siya sa plenary, tatapatan ko siya dyan. At ang sabi ko pa nga sa kanya, dalhin niya yung kanyang mga key officials. At alam naman po ninyo, nangako naman siya. At alam ko, general naman po siya. At sa aking palagay, ang salita ng isang sundalo po ay hindi basta-basta nababali. The Disappointed po ako sapagkat hindi lamang siya wala ngayon, yung kasama po niyang dalawa, kanina nakikinig na po ako riyan, sapagkat ako'y 5 oras nang nakikinig sa inyo, wala rin po yung kanyang mga key officials. Mr. Chair, sila po ba ay nagbigay sa atin ng ebidensya na sila talaga ay hindi po pwedeng pumunta ng plenary? Sapagkat kahit po ako may sakit din, pupunta po ako dyan eh. Sapagkat yun po'y usapan na ano po bang binigay nilang ebidensya, lalong-lalo na po yung key officials niya, tsaka si President Morales, na sila hindi lamang if they are not malingering, Mr. Chair, what evidence did we receive to prove that they are really sick?
Honorable Marcoleta, kanina pong umaga, nandiyan po si General Morales, si Executive Vice President De Jesus, at yung head po nila ng legal na si Attorney Del Rosario. As we were going through the hearing, sinabi nga po biglang si Mr. De Jesus ay nadala sa ospital, si Mr. Morales may sakit, at ganun din po si Mr. Del Rosario. But based on what you mentioned now, the Honorable Marcoleta, pwede po nating hingan ng pruweba na ipakita nila sa susunod na hearing na totoong sila po ay nagkasakit o nagkaproblema habang nandito po tayo nag-hearing. And I recall, yung pong binanggit ninyo na sinabi nyo kay General Morales, a-attend kayo at kung maaari ay magpunta siya dito, Congressman Marcoleta.
Tama po yan, Mr. Chair. Kaya ako po ngayon ay hindi pumunta sapagkat yung mismong taong kausap ko at ang ipinangako niyang dadalhin niyang mga kasama niya ay hindi rin po dumating. At ngayon, wala naman po sa lang pinakikitang mga katibayan na talagang may sakit. Ang tingin ko po, they are all malingering, Mr. Chair. Meron po tayong kasabihan that lightning does not strike on the same place twice. Pero sa hapong ito, 3 beses po nakinidlat po tayo sa isang lugar lang. 3 tao po ay naasahan natin na kung papaliwanag ngayon, bigla silang pare-parehong nagkasakit. Ito po ba ay katanggap-tanggap, Mr. Chair?
Honorable Marcoleta, nung una pong hindi magpunta si General Morales, alam ko na po na siya may sakit. Kaya po, nung magpaalam siya, pinayagan ko po siya, but eventually he came out publicly na sinabi niya nga yung maluba, yung kanyang sakit at may cancer po siya. Pero in the case of Mr. De Jesus and Mr. Del Rosario, no, I'm not informed of their current condition. At yung pong pagkawala nila, kahit sa Zoom lang po, wala pa ho tayong paliwanag. Kung ang tanong niyo po ay katanggap-tanggap po ba yan, hindi ho. And tingnan po natin kung ano po yung magiging hatol ng ating komite. At hindi lang po dito ngayon, meron po tayong contempt powers because we are now under motu proprio hearing in aid of legislation. And number 2, alam naman po natin na may budget deliberations po sila. And I agree with you, pagka po may malingering, as you call it, then Congress, not only this committee can take action. Congressman Marcoleta.
Kasi po, Mr. Chair, alam naman natin ang kahalagahan ng pagdinig na ito. Ayaw ko po naman na isipin ng publiko na nakikinig sa atin na parang they are already taking lightly ito pong kahalagahan nitong pagdinig na ito. At nakikita ko po kanina, bali 1 o 2 tao na lang ang sumasagot sa atin. Hindi ko naman minamalit po yung kakayahan nila na sumagot, pero kung makikita ninyo, pasahan ng pasahan, sapagkat hindi naman po niya lahat masasagot yon. Sana po si President Morales, hindi siya nangako kung talagang siya ay merong karamdaman. Sabi ko nga po sa inyo, pare-pareho tayo nagkakasakit. Alam naman po ninyo, yung sparring partner ko nung 2 linggo ang nakararang, 3 linggo nung tayo nagdidinig dyan. Binawian na po ng buhay sapagkat siya po ay tinamaan din ng COVID. Alam natin ang peligro sa buhay natin. Pero ako nangako ako, pupunta po ako riyan. Dapat sila, ganun din po sana ang pangangakong gagawin nila. Pag nangako ka, pupunta ka. Ganun sana yung gusto kong mangyari. Pagkatapos po, ang dami kong napapansin, Mr. Chair, tinanong kanina ni Honorable Sarate yung 2 mga opisyalis dyan tungkol dun sa nakukolekta nilang yung sa ospital, yung nakukolekta nila pagkatapos binabahagi nila sa kanila bilang mga allowances.
Accreditation.
allowance.
Accreditation allowance. Ngayon, napakasimple po ng tanong ni Congressman Zarate kung magkano yung tinatanggap nila sa bawat buwan nung yun ina-administer pa. Nakakasama po ng loob, Mr. Chair. Hindi man lang nila ma-recall, hindi po ba nila ma-recall man lang, matandaan? Hindi naman natin sila sinasabihan na ibigay yung eksaktong amount ng kanilang tinatanggap eh. Kahit siguro ballpark figure lang, mas or menos. Hindi ba masasagot ng 3 tao na nandyan, kamukha ni Mr. Vargas, si Mr. Limsiaco, kung kasama si Ms. Santiago, at saka yung Mr. Dennis Mas. Eh bakit po, parang kapag tungkol dyan, sila ang tinatanong, kinakailangan pa nilang pangakuan tayo na isusumiti na lamang ang kanilang mga natanggap kung meron man at magpapanggap pa sila na hindi nila naaalala. Pwede bang ulitin natin yung tanong? Hindi naman natin sila pinupuwersa na kunin natin sa kanila yung eksaktong figura o halaga ng kanilang tinatanggap. Mas or menos, Mr. Chair, kung talagang meron silang respeto sa atin, bigyan lang nila tayo kahit idea lang. Magkano tinatanggap nila na allowance mula doon sa accreditation fee na kinokolekt ng PhilHealth?
Doon po sa niraise ni Honorable Marcoleta, yan po'y punto na binanggit ni Honorable Abante at ni Honorable Zarate. Meron po ba makakasagot doon? Accreditation fees collected. Kahit na po approximation, di naman eksakto.
Hindi po, Mr. Chair, yung tinatanggap nila kasi yan binabahagi nila sa kanilang sarili.
Yun nga po.
Monthly, tumatanggap sila pero ayaw nilang banggitin kanina sapagkat hindi raw nila matanda ng detalye, magpipresent na lang daw ng report. Mr. Chair, sa aking palagay, ayaw lang naman nilang makipag-cooperate sa atin. Hindi naman natin sila pinipilit na kunin yung eksaktong halagang tinatanggap nila buwan-buwan nung ina-administer pa yan, yung pondo na yan. Bakit hindi man lang nila sabihin sa atin, mas or menos kung magkano yung kanilang tinatanggap na allowance na bahagi nila doon sa paglikom ng accreditation fund from the hospitals. Para malaman naman natin kung talagang nakikipag-cooperate sa atin ang mga tao na yan. Kasi ako, very disappointed ako, Mr. Chair. Kanina ko pa nakikita na puro yung kwenta kung saan napupunta. Kahit magdamag tayo siguro, mag-usap-usap dito, Mr. Chair, wala tayong makukuha sa mga yan kapag hindi sila talaga nakipag-cooperate. Pwede ba natin silang pasagutin ngayon, kahit na yung 4 lamang na nandyan ngayon, kung maalala nila, magkano talaga yung kanilang tinatanggap na bahagi dun sa allowance from the accreditation fund?
Ang makakasagot sa mga kasama po natin, Mr. Limsiaco, will you be able to answer?
Mr. Chair, Your Honor, pasensya po, talagang wala tayong report na nadala dito relative to that accreditation fee na binahagi sa mga medical personnel dati at saka sa opisyal ng PhilHealth. Sabi nga ay bibigyan namin ho kayo ng report para po mabigay natin ho sa inyo yung kompletong report po. Pero po, I would like to inform you po na ang ating may notice of disallowance po ito, Mr. Chair, na binigay po sa atin ng COA. That's the reason why po na-stop na po ito in the year, hindi ko matandaan po kung kailan po na-stop po ito.
Mr. Limsiaco,
Yes po, sir. Tinitingnan ko lang po.
Anong lingwahe ang mas naiintindihan mo? Sabihin mo sa akin. Para magkaintindihan tayo. Ang sinasabi ko lang, tinanggap nyo kanina na kayo'y nakaka-receive ng monthly allowance do sa accreditation fund na kinokolekta nyo sa mga hospital. Ang tinatanong ko lang ngayon, mas or menos, hindi naman kita pinipilit na sagutin mo kung ano yung eksaktong tinatanggap mo. Mas or menos, magkano yung tinatanggap ninyo buwan-buwan doon sa accreditation fund na yun. Hindi mo ba alam yun?
Mr. Chair, Your Honor, sorry po, talagang hindi ko matandaan po kung magkano yung pera po na binibigay po sa ating mga recipient po noon. Dahil po ako ay hindi po ako isang medical officer po na binibigyan po ng ganong allowance dati po, Mr. Chair, Your Honor.
Mr. Chair, pwede natin silang i-contempt. Kanina dinig ko siya, ang sabi niya, isa siya sa tumatanggap dun sa allowance. Ngayon, sinasabi niya ngayon, hindi na naman sa kasali.
Mr. Chair.
Mr. Chair, Your Honor.
If I may.
Yes, go ahead, Mr. Limsiako. Just a quick reply. Go ahead, Mr. Limsiako.
Yes, sir. Maraming salamat po, sir. Mr. Chair, Your Honor. Ako po ay hindi isang medical officer po. Ay sabi kanina ni Doc Is po, ito ay binibigay sa medical officer at saka sa mga officials ng PhilHealth po. Ako ay nakapasok sa PhilHealth po na hindi ko po matandaan kung ako po ay isang recipient doon dahil po sa sinasabi ni Doc Is kanina para sa medical personnel po ito ng PhilHealth at saka sa mga officials po.
Mr. Chair, tatanungin
Hindi
ko si
ko po
Mr.
matandaan
Vargas, sa
kung
kanya
yun po
nagmula
ay
ito eh.
nakatanggap po ako ng allowance po noon. Kaya nga po, we are saying po, if maaari po, magbibigay na lang po kami ng report po sa inyo para kompleto po na detalye kung sino po ang nakatanggap noon at saka magkano po yung amount, Mr. Chair, Your Honor.
Okay, Mr. Limsiako. Go ahead.
Mr. Chair, para maliwanag lamang po, no? Gusto ko lang tanongin sana si Congressman Marcoleta, si DS Marcoleta about doon sa sinasabi niya accreditation. Accreditation fee yun, no?
Yes.
So, tanongin na muna natin si Mr. Limsiako, gaano po ba kalaki yung accreditation fund na yan?
As mentioned kanina, Mr. Chair, Your Honor, for year 2020 po itong figure natin po, Your Honor, ang ating accreditation fee ay part ng other income ay 7.879 million, Your Honor.
7.9 million.
7.9 million, Your Honor. This is 2020 po nga figure po as of June po.
Teka, wag 2020. Magbigay ka ng whole year, 2019.
Ang 2019 po,
Para klaro,
ay-
kasi half year yan eh.
Mr. Chair, kanina may binanggit silang 20 million pesos.
Yes.
2019 po, sir, is 26.7 million,
Okay,
million, Your Honor. And 2018 po, 26.9 million, Your Honor.
Okay, average of 27 million, Honorable.
Mr. Chairman, tanungin ko lang isa simula si Mr. Limsiako since ikaw naman sumasagot. Magkano sweldo mo, Mr. Limsiako, sa PhilHealth?
Ang aking sweldo
Monthly.
po, monthly ay nasa, pasensya po, pwede ko makita muna po, para makita ko
Sige po.
kung hindi ko matandaan yung basic, sir eh. Sandali, sir, tingnan ko lang po.
Bibigay ka na. Pasensya na, DS Marcoleta, no? Para lang mairelay yung gusto mong mapalabas na nakukuha ng mga board of directors. Kasi parang kaduda-duda nga naman na kung nakakatanggap ka ng sweldo mo, tapos hindi mo alam yung mga natatanggap natin sa ating ahensya, parang napaka-imposible. Ako, bilang congressman, alam ko sweldo ko, alam ko yung mga benepisyo ko. At let's all be honest here, no, sa mga board of directors, no, na alam naman po natin kung magkano ang sweldo natin monthly, magkano? Tapos magkano yung benefits na kukuha natin aside sa ating sweldo? Hindi po napakahirap ng tinatanong ni DS Marcoleta, Mr. Chairman.
Yes. Okay, Mr. Limsiako.
Mr. Chair, Your Honor, ang basic po na sweldo po ay 140,589 po, Your Honor.
140,000. Okay.
Yes po, sir.
Sa iyong pagkakaalam, aside from the 140,000 na sweldo mo, ano pa ang tinatanggap mo sa PhilHealth?
Mayroon po tayong basic rate, tapos may pera po, tapos pera that is 2,000 po, and then welfare allowance po ng 4,000, and hazard allowance po of 9,800.
Okay, sa accreditation, makikita mo,
Now, Mr. Chair,
magkano natatanggap nyo sa accreditation according sa mga record mo?
Mr. Chair, Your Honors, ang accreditation po ito ay hindi na po natin tinatanggap sa PhilHealth po dahil ito po ay may notice of disallowance po. Kaya po we are very sorry po. Hindi namin maalaala dahil matagal na po ito na-stop po ng ating corporation.
So in other words, hindi ka nakatanggap sa accreditation fee?
Mr. Chair, Your Honor, yun nga po yung iniisip ko kanina pa po kung nakareceive ako dahil
Yes or
sinasabi
no?
ko nga po,
Yes or no
hindi
lang?
po ako medical officer po.
Mr. Lim siya ako, yes or no? Nakatanggap ko o hindi?
Sorry sir, talagang hindi ko po
No.
matandaan
Anyway,
dahil po kailangan makita natin yung pera
Sandali,
po.
Mr. Chairman. Ilan taong ka na sa PhilHealth, Mr. Chairman?
Nasa malapit po, 20 years na po ako sa PhilHealth po.
8 years. So,
20 po, 20, malapit po.
20 years.
Yes, sir.
Okay, so...
Honorable Fernandez, we'll give back the time to the Honorable Marcoleta. Please, Honorable Marcoleta.
Pwede ba pasagutin natin si Mr. Vargas, Mr. Chair, kasi sa kanya nagmula na sila'y tumatanggap ng allowance. Sige siya, magkano kung maalala niya ang tinatanggap niyang allowance?
Dr.
Mula dun
Vargas.
sa accreditation na sinisingil nila sa mga hospitals.
Mr. Chair, Congressman Marcoleta, board resolution number, because I'm checking on this. PhilHealth Board Resolution number 1147 of 2008 authorized the disbursement from the collection of accreditation fees for specific purpose under Office Order 58/2008. So nagsimula po ito noong 2008 from the
Hindi ko naman tinatanong sa iyo yung tungkol sa circular na yan eh. Tinatanong lang kita kung maalala mo magkano ang tinatanggap mo monthly. Kaya kami nagkakaroon ng problema dahil sa mga pagsagot ninyo eh. Alam mo, test ko lang yung credibility ninyo eh. Kanina pa eh.
Yes, Mr. Chair. Mr. Chair, Congressman. This is not given monthly. It was given annually, and I think po because this was stopped in 2014, more or less po 20,000 a year.
Mr. Chair, if I may, para matulungan lang natin si DS Marcoleta, since nasa SUMSA.
Kaya kong tanungin sila, DS Dan, hindi ko kailangan ng tulong. Sila yung dapat tulungan eh.
Yeah, hindi, what I'm
Dapat
trying...
i-refresh yung memory ng mga yan.
Tatanong ko lang-
Kanina, sinabi niya, meron silang monthly tinatanggap. Sa
Yes,
mismo
correct.
nagsabi eh. Naka-record tayo eh. Ngayon, sinasabi na naman niya, hindi monthly. Paiba-iba ang sagot ng mga tao na yan.
Mr. Chair.
Mr. Vargas, can you clarify your statement, please?
Yes, sir.
Yes.
Again, this started in 2008 and stopped in 2014. Ito po ay binibigay, as I recall, and I'm checking, annually po. At ito po ay nakabase doon sa nakukolekta na accreditation fee. Tapos po, ito po ay ibinibigay, depende po doon sa percentage distribution para po sa mga holding the medical positions, 55%. Yun naman pong sa mga holding mission critical positions, they are provided the 35%. So that's around 90% of the collected accreditation fee, and the 10% is retained for other purposes. So, iba-iba po siya, taon-taon, depende po sa accreditation fee, and was stopped in 2014 because may notice of disallowance.
So sa pagkakaalala mo nga, ilan at magkano ang natatanggap mo? Sa pagkakaalala mo, napakasimple ng tanong eh. Ang dami mo pang binasang circular eh.
Mr. Chair, sa pagkaalaala ko po ay around 20,000 annually po.
O yun lang, dapat sana kanina sinabi nyo na yan eh. Para hindi na sana tayo tumagal. Alam mo kung paano namin kayo sinusukat? Sinusubok lang namin kayo. Kung talagang pati pagsagot ninyo, talagang makakakuha kami ng katwiran at katotohanan sa inyo. Masyado kayong paligoy-ligoy kapag ka alam ninyo na maring tatamaan kayo. Mr. Chair, meron ba tayong truth serum dyan? O kaya siguro pinakamaganda nito, tatagal kasi tayo eh. Kung meron tayong truth serum, sigurado tayo na lahat ng isasagot sa atin yan, nakasaling sa katotohanan. O kaya, kumbaga sa mga engkanto, Mr. Chair, kung meron tayong kumukulong tawa na yan ay pahalukay natin kay Congressman Barbers, lilitaw yung mga tao, yung mga itsura ng mga tao, nakasama at sangkot sa mga sindikato. Kaso wala tayong kumukulong kawa, Mr. Chair, kaya hirap na hirap tayo, pinagkakagaan natin silang tanungin, paligoy-ligoy naman sila. Sana wag ganon. Katulad po kanina, napansin ko po si Miss Santiago, actuary yan Bakit po siya sumasagot sa mga tanong na wala namang kinalaman sa actuary? Siguro because of that, I will move, Mr. Chair, na isama natin ang subject ng actuary sa ating pagdinig sa mga susunod na mga araw, sapagkat doon sa listahan mo ng subjects, hindi kasama ang actuary. Kasi siya yung sagot na sagot doon sa mga tanong, at tingin ko naman, walang kinalaman sa actuarial study o kung saan. Para matanong din natin siya kung paano natin mapagsasaligan yung kanyang actuarial estimates, samantalang yung credibility ng database ng PhilHealth ay talagang questionable. Kapag yung data mo, Mr. Chair, questionable, walang actuarial estimates o kahit anong actuarial study ang magagawa mong matino dyan hanggat hindi nila na-perfect yung credibility ng kanilang actuary. Mr. Chair, kanina narinig ko, meron pala silang integrity office. Totoo pa ba yun, Mr. Chair? Narinig mo rin ba yun?
Congressman Marcoleta, again?
Kanina po meron nag-testify na meron palang integrity office sa PhilHealth. Naalala niyo po ba't narinig po ba niyo yun?
It was Mr. Limsiaco who mentioned that, or
Hindi po. Merong representative yata yung isang vice president na hindi nakadalo ngayon sapagkat sabi mo nga, isa siya sa may sakit.
Attorney Del Rosario is the head of legal.
Pero wala siya ngayon, Mr. Chair. Siya ay kinatawan lamang ng isang staff niya yata at siyang nagsabi na merong integrity office pala ang PhilHealth.
Do we have that in Zoom?
Nasa Zoom po siya kanina, nakita ko.
Yung pong kasama ni Attorney Del Rosario kanina, parang tatlo sila. Yung po ba yun, Honorable Marcoleta?
Yes, Mr. Chair. At siya yung nagsabi na meron silang integrity office, merong nagtanong sa kanya, parang tinanong ni Minority Leader Benny Abante kung ano na yung nagawa nila to at least mitigate yung mga nangyayaring napapansing mga hindi mabuting nakikita sa loob ng PhilHealth. Kanina nandyan sa Zoom
Can we please can we please have the Office of the Legal? Kasama po natin kanina sa Integrity Office.
Your Honor, are you referring to Mr. Mangawang?
Yes, Mr. Mangawang, is he still there? Ano po bang nangyari with the indulgence of the Honorable Marcoleta? Ano po bang nangyari? Ba't nawala si Del Rosario, Mangawang at yung tatlo? Sabay-sabay po ba nagkasakit yung tatlong yon?
Yun nga yung tinatanong ko sa iyo, Mr. Chair.
Yes, no, Honorable Marcoleta, yung tatlo kasi kanina was General Morales, Executive Vice President De Jesus, and Attorney Del Rosario. Pero tama po kayo, napansin ko rin kanina, kaninang nagsalita sila about the waiver doon sa AMLA, nawala na rin
Sakit po silang lahat.
yung tatlo, nawala.
Sabi ko nga sa inyo, baka they're only malingering, Mr. Chair. Hindi naman po pwedeng parang pinagtatawanan na lang nila tayo at pinalulusotan nila tayo ng ganito. Nagtsitsaga po tayo, lalong-lalo na po kayong nasa plenary ngayon. Alam po natin ang panganib ng COVID.
May we direct the COMSEC to write letters to the following who were here earlier in Zoom to show cause for this committee not to issue an order of contempt.
Mr. Chairman, if I may, Mr. Chair.
Okay, Honorable Marcoleta.
Mr.
Pwede
Chair.
po bang, ano pong pangalan nila?
Mr. Chairman, I'm Attorney Mangawang, Corporate Secretary.
Attorney Mangawang, are you the deputized official of sino na yung ano mo, yung sino na yung lawyer na nag-deputize sa'yo?
Mr. Chair, Mr. Congressman, I am the Corporate Secretary.
Yes, but you were earlier speaking for somebody who is a vice president because he is indisposed allegedly, hindi ba?
It was not me who was answering the question earlier, Mr. Congressman. It was Attorney Roger Pocalan on behalf of SVP Jojo Del Rosario.
Attorney Bukalan, because he was the one who fed us with information that there is a so-called integrity office in PhilHealth. Is this correct?
That's what I've heard also, Mr. Congressman, from Attorney Roger
What do you
Pocalan.
mean you heard? Hindi mo alam na ikaw ang corporate secretary, sinabi niya merong integrity office, and now you are still supposed to verify kung totoo o hindi?
Yes, there is integrity. I think monitoring committee is the name of the committee as part of the whistleblowing protection policy. That's the committee.
Who are the members of this integrity committee?
Mr. Congressman, I have to check the corporate order, but the head is the SVP for legal sector,
Who is?
who is Attorney Jojo Del Rosario.
Who just fallen sick
Yes,
hours ago?
yes, Mr. No, he had hypertension yesterday during the Senate hearing. And he had to go to the Senate clinic, I think twice, Mr. Congressman.
Paano makakasiguro ang committee ito, attorney, na itong committee ito ay merong integrity para gawin yung function na inaasahan ng PhilHealth at ng publiko? Paano kami makakasiguro na itong opisinang ito is functioning within the objective set for itself, for the purpose of at least allaying the fears of the public, and as well as supporting and helping this committee press out the problems involving PhilHealth?
Mr. Congressman, I think we just have to require the Integrity Monitoring Committee or Management Committee to submit a report of what it has done since its creation.
So palagi ganun na lang. And then we will take the report as it is, na parang totoo yun. Na parang we hold it as true. Sino magbe-verify na totoo yun o hindi for our consumption? For example, may I give you some examples? Pwede ba namin i-require ngayon ang PhilHealth officials through this integrity office that all key officials of PhilHealth should submit to the committee their respective SALNs and ITRs para lang makumpara namin? Will that be possible to be undertaken by the integrity office?
Yes, Mr. Congressman, I think the corporation has already submitted copies of the SALN of the key officials of PhilHealth.
What about ITRs?
Including ITRs from the from our fund management sector who has copy of all our ITRs.
Where did you submit it? In the committee? The hearing this?
Yes, Mr. Congressman, we submitted all our SALN through the corporate planning department.
Is this true that the key officials of PhilHealth have already submitted their respective SALNs and ITRs to this committee?
Mr. Congressman, can we refer the question to the SVP for Management Services Sector, Mr. Dennis Mas, because the HRD is under his office, who has the copy of all the SALN of key officials of the corporation.
Good afternoon, Congressman, Mr. Chair. I am Dennis Mas, Senior Vice President for Management Services. I handle HR and General Services of PhilHealth. At PhilHealth, we have this PhilHealth Whistleblowing Committee. This is in compliance with the GCG Memorandum Circular 2016-02 dated April 22, 2016. The coverage of this
I'm
PhilHealth
sorry to cut you short, Mr. Mas. No, I'm only asking you if you have already submitted, or if it is possible for this committee to submit copies of your SALN
Sir,
and
I
ITR
understand,
to
sir,
this
we
committee.
already submitted the SALN of all the request as requested by the Committee on Public Accounts. I understand we already submitted.
Mr. Chair, can you please confirm that?
Yes, we have not yet received the SALN. Baka pwede pong, anyway, sige, basta isubmit na lang po sa amin.
Submit na namin, sir.
And then, Mr. Chair, can we ask them if we can really hope something from this committee that they can at least help us straighten or make the system efficient, more particularly in pinpointing the areas of corruption in PhilHealth. If they have a fraud risk framework and fraud profile to determine the situs or area of corruption and how the culprits, if ever, how they manipulate these corruption activities, and where do they hide their loot. Number two, if they have data analysis to determine the concentration of fraud in PhilHealth. So that, Mr. Chair, if we can ask them to undertake and organize this task force or frameworks, they will probably be able to plug the loopholes as soon as possible dahil marami na talaga ang nawawalang pondo sa PhilHealth na alam na nating kahit hindi pa natin napapatunayan ng lubusan, dito lang sa mga datos na pinresent mo, Mr. Chair, and on the assumption that the COA is quite accurate in submitting all this data, preliminary data to the committee, nakakakilabot, Mr. Chair. If I can go now to the ACR or the all case rate, Mr. Chair, which is the subject matter of today's hearing. Sino po bang pwedeng sumagot malibang kay si Dr. Vargas na lang ba sumasagot dyan? Wala na po bang ibang sumasagot?
Honorable Marcoleta, before you proceed, nagsubmit na po pala sa HR pero hindi pa po submitted sa atin. So, at any rate, I think you are asking for an official submit from this committee.
Parang subpoena, sir. Pero
Opo.
na-prepare na ho namin.
Yes.
Pag release yun ng subpoena, i-release namin lahat.
Yes. So, if
Wala na.
there are no
File na.
yes, if there are no objections, we
Okay, Mr. Chairman, I move that we subpoena all the SALN of all the board members of PhilHealth and those officers and officials of PhilHealth to be submitted here in this honorable committee. I so move, Mr. Chairman.
motion for the submission of the subpoena. We will also include in the motion what was relayed earlier by the Honorable Deputy Speaker Villafuerte on the waiver of the AMLA. So with that motion there being no objection, motion is carried. So Committee Secretary is directed to issue the subpoena to the PhilHealth Corporation. The Honorable Marcoleta, you may continue.
Salamat po, Mr. Chair. Bago po tayo napunta sa sistema ng all case rate, ang matandang sistema ay yung tinatawag nating fee for service. Tama po ba yun sa PhilHealth?
Mr. Chair, yes, Mr. Congressman Marcoleta.
Ito pong fee for service ay ipinatupad hanggang 2014 lamang po. Tama po?
Tama po.
At pagkatapos tayo ay pumalaot na sa ibang sistema, kung tawagin nga natin ay all case rate.
Mr. Chair,
Tama
tama
po.
po.
Ano po ba yung dahilan kung bakit pinalitan natin yung fee for service at ipinalit natin yung all case rate?
Mr. Chair, una-una po, to facilitate the reimbursement, kasi po ay matagal po ang proseso ng ating fee-for-service. At yun na nga po, because of the, yung pong mga inefficiencies ng fee-for-service po ay gusto nating mapalitan. Pangalawa po, to provide the immediate information to our members pagdating po sa kanilang benepisyo, dahil pag tinanong po kung magkano ang benepisyo ko, halimbawa po dun sa binabanggit na sakit, masasabi po natin kaagad-agad, hindi katulad po ng nung tinatawag po na fee-for-service. And yun nga po dito, para po maging mas maayos po yung paraan ng pagbabayad natin.
Sa mga tweet, Mr. Chair, ang sinasabi ni Dr. Vargas, kaya pinalitan yung fee for service ay merong advantages na makukuha. Ang sinasabi niya, mapapacilitate po yung pagbayad, ma-address natin ang inefficiency, at kung ano-ano pang mabubuting bagay na nilalayon noong all case rate. Sa palagay niyo ba, Mr. Chair, Mr. Vargas, ito po bang layunin na ito ay natupad ngayon? Katulad po nung sinasabi niyong to facilitate, kanina po ang dami pong nagtanong at nag-testify na napakarami pa po ninyong outstanding na hindi nababayaran sa mga ospital. Anong pinag-iba ngayon ng fee for service at saka yung all case rate na hindi naman yung na-address yung talagang pinakalayunin kung bakit pumalaot kayo sa ibang sistema?
Mr. Chair, ang atin pong, gaya po na nabanggit natin, isa ay yung para po mapabilis yung pagbabayad at nag-improve naman po ang ating turnaround time. However, meron talaga pong pagkakataon or may mga claims po na hindi kaagad natin mababayadan, lalong-lalo na kung ito ay mga claims na kailangan nating ibalik sa mga ospital para po mag-comply sila. However, meron pong mga pag-aaral na gawa na it actually improve po the turnaround time. Ngayon lamang pong panahon syempre ng pandemya ay kahit po kami ay hindi kaagad-agad nung una nakakapagproseso or nabawasan ang pagpoproseso dahil meron din po kaming mga sumunod din po kami dun sa mga ECQ or MECQ. Pero again po, pagdating po dun sa mga maayos na claims, bumilis naman po ang ating pagbabayad.
Dr. Vargas, ang ibig kong sabihin, ang consideration lang rito ay pagpapabilis. Hindi ba meron pang ibang considerations na mas importante dyan? Napabilis nga, pero napabilis din yung pagnanakaw ng pondo. Malaking problema pa rin, hindi ba? Katulad nitong itong case rate na ito, na sa aking tingin, ito ang pinakaugat kung bakit nagkakaganito ang pondo ninyo. Kanina po, yung pneumonia, ang talagang classic na example dito. Kung halimbawa, ang pneumonia po ay sa standard case rate ninyo is 15,000 pesos lang. Depende naman kasi sa grade o level ng hospital eh. Halimbawa, ang grade ng hospital level 1. Mas mura po yung kaysa sa level 2 o kaysa sa level 3. Paano kung halimbawa, ang nagastos niya sa 20 pesos na case rate ng pneumonia, ang nagastos niya lang halimbawa 10 pesos, 10,000 pesos or 15,000 pesos, hindi ba mandatorily babayaran mo rin yung 20,000, Dr. Vargas, kahit na yung service na ibinigay sa pasyente is less than that amount? Tama po?
Mr. Chair, tama po. Because ang ating case rate ay fixed amount.
Tama. Kanino po ngayon mapupunta yung ibinayad yung 20,000 pesos, samantalang ang nirender lang ng ospital, halimbawa, level 1 lang, ay 10,000 pesos. Kanino mo mapupunta yung 10,000 pesos? Babalik po ba sa inyo yun?
Dahil, Mr. Chair, dahil po yung
Kaya
paraan...
tanong sa inyo, babalik ba sa inyo yung 10,000 pesos sapagat ang nagasta ng ospital na yun ay 10,000 pesos lang?
Hindi po.
Ito yung problema. Hindi babalik sa PhilHealth. Kanino mapupunta?
Mr. Chair, nasa ospital po, kasama rin po
Okay.
ang ating doktor because kasama po dun sa rate natin ang bayad sa doktor.
Ito nga ang problema, Dr. Vargas. Napakasimple nito. Binayaran mo ng 20,000 yung pasyente ng pneumonia sapagkat all case rate nga eh. Mandatory babayaran mo eh. Ang pinaka-problema ang sinasabi ko sa inyo, hindi naman sa lahat ng pagkakataon, 20,000 nga yung bayad eh. Paano yung maraming pagkakataon, maraming instances na 15,000 lang ang binayad o kaya 10,000 lang? Ibig sabihin yan, ang PhilHealth nagbibigay ng pondo, binabayaran ng isang serbisyo kahit hindi yun ang kanyang actual na serbisyo. Ang tawag po dyan, technically, is malversation, Dr. Vargas. Kung hindi nyo po nakikita ang legal implication yan. Bakit? Sana man lang po, kung bumabalik sana sa inyo eh. Eh hindi. Kapag ka nagkasakit po at saka binigyan nyo ng 20,000 na ito na po yung kargada nun, all case rate, wala na po, hindi na po babalik yun. Money down the drain na po yun. Kaya po, nalulugso ang pondo ng fill rate nang dahil doon. Wala kayong sistema. Sana ang sistema po, ma-verify ninyo, okay, parang temporary lang yung 20,000. Pagkatapos, nung makita nyo na 50,000 lang, dapat i-refund sa inyo ng ospital. Sapagkat yun po naman ay hindi ginasta. Pera po ng ano yun, ng miyembro yun eh. Ganun dapat po para hindi naging ganyan ang kalagayan ng pondo natin. Bakit po noong 2012, Dr. Vargas, 23 cases lamang po ang pinag-aralan nyo sa case rate? 23 cases lang, hindi po ba? 2012, diyan kayo nag-umpisa. Tinetesting lamang po ninyo yun, di ba?
Mr. Chair, opo, nung 20, yes po.
Pagkatapos po ng 2014, nung mawala na yung fee for service, ginawa nyo ng lahat. Ano ang philosophy behind that? What is the logic behind encompassing all cases? Samantalang ang tinesting po ninyo is 23 lang. Pwede ba nyo ipaliwanag yon sa isang napaka-ikli at napaka-simpleng maling paliwanag?
Mr. Chair, I would like, if you would allow me po, Mr. Congressman, in 2013, because of the evidences of the advantages of paying case rates, at ito po'y binabasa ko mula po sa circular,
Sino po yung nagsabi niyan? Sino po yung gumawa ng circular na yan? Diyan po kayo magaling eh. Sinasabi niyo because of the advantages of so and so. Paano po ninyo nalaman na mayroong advantage? At tinatanong ko lamang po sa inyo, 23 cases lang po ang tinesting ninyo.
Okay, Mr. Vargas, si VP, Senior Vice President Mercado ba ang health policy that time? Yung may hawak na posisyon nyo?
yes, Mr. Chair,
Anong posisyon mo nung panahon na yon?
nung 2014
14.
po, ako po ay nasa Corporate Affairs Group.
Corporate Affairs. So si Ms.
Opo.
Mercado ang health Senior Vice President for Health Policy.
Hindi ko lang po matandaan kung nung 2014 siya po ang Senior Vice President. Pero ako po, since 2012, ako po ay na-assign sa Communications Department noong 2012.
Okay.
Noong 2013 to 2018, ako po ay nasa Corporate Affairs Group.
Okay.
Ako po ay nalipat sa dito sa posisyon na ito na-appoint noong April of 2019.
At 2019 ka lang.
Opo.
So, eto, tanong ko sa iyo, 2019 ka lang pala, no? Yung tinatanong ni Kong Marcoleta na potential corruption, talaga nandyan yan.
Pwede pong nadya dyan, not only on the case rate, but
Okay.
in any others po.
Sa case rate, di ba? Pwede talaga.
Yes po, because...
Lalo sa private hospitals, tama?
Opo,
Okay.
dahil makikita naman po natin at nabanggit po ninyo, may mga kaso na naka-file
Tama.
with regard to this.
5,000 kaso, tama?
Yes po.
Okay, pangalawang tanong. Kung merong sindikato dyan, 2019 ka, no? Pababa. Sigurado, kakuntsaba yung ospital o doktor, kung sino man, kung ano man programa. Tama?
Mr. Chair, maaari po.
Thank you. Honorable Marcoleta?
Salamat, Mr. Chair. At talaga namang lumilinaw na ang pinakaugat ng pinaka-problema dyan ay yung case rate na yan. Kasi sa case rate, tinatawag nilang fixed rate allowed by policy. Siyempre, sasabihin nila, wala silang pagkakasala rito. Wala silang pagkukulang dito. Kasi ito ngayon ang polisiya. Ito ang pinagtibay. May batas tungkol dito. Ang problema lang, Mr. Chair, kagaya ng paghalimbawa natin sa pneumonia kanina, 10,000 pesos lang ang actual expense. Pero binayaran ng PhilHealth, yung 10,000 na sobra na yon, hindi naman pala babalik sa kanila. Bakit wala po silang sistema na ang pinakamaganda ron para masinop natin ang pondo, yung sobra na yon dapat bumalik po sa PhilHealth para magamit pa ng ibang tao. Hindi po ba yon ang pinakamabuti, Dr. Vargas?
Mr. Chair, opo, pero kung titingnan din po natin, kaya po ang isa sa naging, and in 2017 po, ay at least naman po ay pagsunod na rin sa findings ng COA, ang management po ay nag-propose na rin sa board ng una, either we retain it as a status quo, or second, babayadan po kung ano, lower than the case, kung lower than the case rate, babayadan po kung ano yung actual. Kasama din po dito either yung sinasabi na tiered payment, yung pong binabanggit nyo kanina.
Bakit na hindi po ganun ang gawin ninyo?
Opo.
Yung sobra, kinakailangan po ay kunin mula doon sa ospital sapagkat hindi naman nila nagamit yon. Ibig sabihin, kung ano po talaga yung nagastos lamang, kailangan kunin natin yung sobrang pondo na yon para maibalik sa PhilHealth, magamit po ng iba. At sa ganon, may iwasan po natin yung conditions ng corruption. Kaya po nagkakaroon ng ganitong mga pangyayari. Nagiging natetempt po yung mga nasa loob na gamitin ito sapagkat napakalawak ng area ng possible corruptions. Hanggat hindi nyo tinatakpan yung butas na ito, palagi dito manggagaling po yung anomalya na may kinalaman sa pondo.
Mr.
Bibigyan
Vargas.
ko po kayo ng isang magandang halimbawa. Paano nyo i-resolve ito? Ito pong merong isang mag-anak. Yung kanila pong anak na babae ay ipinasok sa Manila Doctors Hospital sapagkat nagkaroon ng nagkaroon ng bukol yung kanyang lieg. Pagkaraan po ng isang araw, na-diagnose po siya na meron po siyang COVID. Noong July 16 po, nasa akin po yung mga dokumento Nagbigay po hindi ko po alam kung ano yung CF2 form mula sa PhilHealth yun. Yung po doktor ng Manila Doctors Hospital, ang nagngangalang Christine Karingal, pinirmahan niya yung CF2 form ng PhilHealth reflecting a deduction or benefit of 143,000 doon sa pasyente. Pagkatapos, July 16 po yon. Kasi na-confine sila ron at sila nagkaroon na rin ng quarantine dahil nga ang sabi ng Manila doctors, nakapag-contact siya ng COVID. Ang masakit ito, Dr. Vargas, July 17 o kinabukasan, nagbago yung statement of account ng Manila doctors na walang bigla yung 143,000. Wala na yung benefit na yung binura nila. Alam po ba ninyo kung anong dahilan? Nasuri daw sa x-ray na wala naman palang COVID yung pasyente. Ngayon, ang binayad po nilang total, pagkatapos ng more than 15 days na confinement, 942,000 pesos, kahit piso po ay walang naibigay na tulong ng PhilHealth. Sumulat po yung magulang ng pasyente sa inyong Benefits Administrative Section ng NCR ng PhilHealth Regional Office. Hanggang ngayon po, tikom ang kanilang bibig. Bakit po naggaganito ito? Bakit po naglagay sila ng 143,000 at kinabukasan ay tinanggal po nila? Saan napunta po yung 143,000? I am sure, sabi nyo kanina, merong siguradong claim filed by the Manila doctors. At maaring yung claim na yon, binayaran nyo na ng 143. Pero yung pasyente po, ni singkunduling wala pong nakuhang benepisyo. By August, alam po ba niyo yung ginawa ng pasyente? In-update pa po niya yung contribution niya sa PhilHealth ng 5,000 pesos. thinking or hoping that makakuha siya ng kahit anong benepisyo. More particularly, yung pinangako na pinirmahan ng doktor na 143,000. Pero hanggang ngayon po, wala silang binigay kahit na piso lang. Paano nyo i-resolve? Ito po yung case rate. Pagkatapos sasabihin nyo kanina, napakaraming advantages nito. Hindi po totoo yun. Kanina po nabanggit yung katarata. Babalikan ko kayo dito at kinakailangan magkaroon kayo ng sagot dito. Anong gagawin niyo sa Manila Doctors Hospital na nangako na magbibigay ng 143,000 pagkatapos ang kanyang siningil ay total of 942,000 without any benefit or credit to the poor patient. O ito pa po, isang example para lang hindi ako mawala. Ito po yung cataract na binigyan ng diin kanina. Talagang makikita po ninyo kung nasan yung area ng corruption dito eh. Ito naman po ay isang maliit na clinic sa Marikina City. River Valley Eye Center, no? Hindi ko nababanggitin ang pangalan ng doktora. Ang procedure po ba ganito? Ito cataract lang po. Ang sabi ng River Valley Eye Center dito sa Marikina, mamili ka kanya ng lente na gusto mo. Magmula sa 8,000 to 25,000 pesos. Iyon ang range kasi kanya iba-ibang lente, may nanggaling sa China, may nanggaling sa United Kingdom, may sa US, etc., etc. So yung tao, mukhang gusto naman niya siguro, nanggaling naman siguro sa US, imbes na China, pinili niya yung 17,000. Ang buong akala niya, Dr. Vargas, sa 17,000 na yon, makakakuha siya ng discount. Yun ang pagkakaalam nila. Alam nila ang PhilHealth nakakatulong eh. Alam niyo ba ang ginawa ng River Valley Eye Center? Kinuha lamang yung kanyang PhilHealth membership data record. Pagkatapos ang sabi sa kanya, magbayad ka na ng 17,000. Paano po kanya? Wala po ba akong discount sa lente? Hindi na kanya, yung surgery kanya, okay na yon. Wala ka nang babayaran sa surgery. Ang napansin po dito, Dr. Vargas, wala man lang kapali-paliwanag, masyadong malihim yung ospital o kaya yung clinic kung ang pag-uusapan yung pagpapaliwanag ng karampatang benepisyo ng isang pasyente. Parang tikom na tikom, parang hindi sila transparent. No, parang merong secrecy doon sa pakikipag-negotiate nila sa pasyente. Dito lamang mapapansin nyo na talagang talamak dito yung, totoo ba ito na wala siyang na yung 17,000 wala siyang discount sa lente sapagkat yung surgery ay ibinigay ng libre sa kanya. Bakit naman yung kapitbahay niya baligtad ang nangyari? Isang mata lang ang pinag-uusapan dito, Dr. Vargas. Yung kapitbahay niya siningil ng 10,000 pesos, meron na siyang lente, libre na yung surgery. Bakit ganon ang nangyari? At saka bakit ayaw nilang ipaliwanag kung ano ba talaga? Kasi kahit ako ang pasyente siguro, Dr. Mugan, gusto ko siguro malaman para sa referensya ko, ano ba talagang ginawa mo sa akin? Ano ba talagang gastos ko? Ba't hindi mo ibigay sa akin? Ba't hindi mo sabihin sa akin kung magkano talaga ang benefit na nakuha ko sa PhilHealth? Para hindi naman ako nagdududa sa'yo. Be it in the lente, be it in the surgery, o kung professional fee or whatever. Dapat ganon ipaliwanag mismo nung pasyente, nung ospital, at saka nung clinic. Para sa ganon, yung pasyente hindi nag-aalala kung nakabayad siya ng sobra o bakit hindi man lang siya naayudahan ng PhilHealth. Sumasama ang loob nila sa inyo Dr. Vargas. Maring hindi nyo alam ito, pero lahat ng ganitong mga klase, napakarami nito, sumasama ang loob nila sa inyo sapagkat wala kayong coordination siguro sa ospital o kaya yung coordination ay talagang ganon para yung sindikato malayang makapag-operate. Sinasabi ko itong mga actual cases na ito sapagkat ito ay nasa sinasabi mong whole case rate. Na kanina, ang magandang layunin ay para sana mapabilis, maging efficient, kung napabilis mo nga sana. Pero it has created necessary evil, Dr. Vargas. So, babalikan kita. Ano ang remedy ng tao na initially binigyan nila ng pag-asa ng PhilHealth will credit at least 143,000, mabawasan ang kanyang ibinayad sa Manila Doctors, Pero he ended up with nothing. And he paid 942,000 pesos. Nothing from PhilHealth. What can he do?
Mr. Chair, Mr.
Mr.
Congressman Marcoleta, sir, if, well, later on, I would like to get the name of the patient because we can check that with our records right after and see what has happened para po mabigyan natin at magawan ng tamang benepisyo na kailangan makuha ng pasyente as eligible patient. Second po, we will check with the hospital that you said kung ano po yung nangyari dito. So, and we will get back to you po kung ano po ang nakita natin pagdating una sa claim, kung paano po ifinal ng ospital para po mas masagot ko kayo ng kung magkano ang benepisyo na kailangang mapapunta sa pasyente. Pangalawa po, pagdating naman po doon sa mga cataract cases, ang atin pong package for cataract is 16,000 at ito po ay hindi lamang para sa surgery. Ito po ay para po doon sa surgery at para sa bayad sa doktor. Pero doon po sa hospital charges, kasama po doon ang lente. Kasama rin po yung bayad sa operating room fee. Tapos yung pong binabanggit ng doktor na surgery na sinasabi niya ayon po sa inyo ay libre, doon po sa case rate may kasama po doong porsyento na para sa doktor, para sa surgery talaga. So ang isa po natin kailangan din nating ma-check again because we pay for the fixed rate, pero kung halimbawa po ang gusto ng pasyente na lente ay mas mahal, then maaari nga pong siya ay masingil ng ating mga ospital or ng clinic na binanggit nyo or ng doktor pagdating po doon. But again, we have to check on the data or on the claims. Ganon din po yung isa nyong nabanggit. Kaya nga po, yon po. Pangalawa po is siguro po kailangan din namin talagang palakasin ang information campaign para po ang ating mga pasyente at ang ating mga miyembro ay mas alam po nila kung ano ang benepisyo na makukuha sa PhilHealth at dapat po itong benepisyong ito ay mai-demand po nila sa ating mga doktor at sa ating mga ospital. Because yun po yung talagang benepisyo na dapat makuha sila.
Sa makatid, inaamin mo rin, Dr. Vargas, na talagang yung pagpapaalam o yung information sa mga kababayan natin ay talagang mababa sapagkat nangyayari itong mga bagay na ito katulad nitong actual cases na sinabi ko sa iyo na kung saan napapansin nila malihim yung pakikitungo ng ospital sa kanila kapag ka ang kanilang tinatanong ay yung ayudang makukuha nila sa PhilHealth. Nahalata nila ito eh. Isang napakalaking bagay ito, sana mapansin nyo na dito talaga nag-uugat ang ito ang pinag-uugatan ng anomalya. Kung ito'y malinaw, kung ito'y transparent, hindi siguro kayo mapupunta sa ganyang kalagayan na ngayon ay dinidinig natin ang napakalaking sigalot na bumabalot ngayon sa PhilHealth.
Opo.
Kaya nandito yung pagkukulang. Kaya kanina, tinatanong kita, baka mas maganda pa nga siguro kung fee for service na lang sapagkat itong fixed rate na sinasabi ninyo, nasasayang, nawawaldas ang pondo natin sapagkat mapipilitan kayo na bayaran yung isang serbisyo sa isang pasyente kahit na ito ay mas mababa doon sa original ninyong binayaran. Ngayon, wala pala kayong mekanismo para sana yon ay ma-recoup ninyo, makuha pabalik para yun sana ay mapaikot natin uli, magamit pa ng marami nating kababayan. Yun ang pinaka-mahirap at pinakalantarang area ng corruption na nakikita ko ngayon.
Mr. Chair.
Mr. Dr. Vargas, well, number one, gusto ko lang pong ilinaw na yung case rate under the PhilHealth now ay hindi po dapat tawagin na all case rate. Kasi nga maraming obserbasyon na talagang mali. So, wag nating bigyan ng masamang konotasyon ang all case rate. Nagkataon lang naman, sinasabi namin, mali yung policy nyo. Yung fee for service naman na Honorable Marcoleta, iniiwasan na rin ng maraming healthcare systems, saka sa kadailanan na kung minsan tinataasan ng mga ospital, yung mga pribado, yung pagbayad. Kaya nga po yung sinabi natin sana, gawing ceiling. Yan yung ceiling ng pinakababayaran at pag-aralan ng tama kung magkano talaga ang dapat na bayad. Ngayon, Dr. Vargas, naintindihan ko, 2019 ka pala nandyan, no? But I think, first, number one, you don't defend the all case rate because you don't need to defend it. Okay, nasa corporate ka dati, pero hindi mo kailangan depensahan yan. And number two, kasama sa reforma dyan, yung baguhin yung ganitong sistema. Ano yung pinakatamang angkop na sistema para yung binabanggit ni Congressman Marcoleta ay magawa natin. Yung tamang pagbayad at hindi masayang ang pondo ng PhilHealth.
Mr. Chair? Congressman Marcoleta. Opo, una po doon sa puntos po ni Congressman Marcoleta, our facilities and our professionals that we accredit, actually po, they sign a performance commitment sa PhilHealth. So, kasama po dyan sa performance commitment ang pagbibigay ng tamang impormasyon sa ating mga professional lalo, no? So kung ito may mga ganito po katulad ng nabanggit nyo na hindi man lamang nag-explain or hindi man lamang nagsasabi, again, if we can get the names of the doctor so that we can call their attention. Kasama naman po yan dun sa ating tinatawag na healthcare provider assessment monitoring. Doon naman po sa binabanggit ni Chair, tama po kayo. Sa ngayon po actually ay kami po ay pumupunta or tumutungo sa pagpapalit ng panibagong provider payment mechanism at ang tinitingnan po natin ngayon ay kung ano yung nasusulat sa batas ng Universal Healthcare Law. Sa ngayon po ang aming talagang ginagawa, especially po nung pumasok na ako dito sa sektor, at ito naman po ay dala na rin ng mga direktiba, nag-OIC po ako ng 2018, no? April, na-appoint lang ako ng 2019. Ay kami po ay naggumagawa ng costing exercise. Ito po yung talagang pangangalap ng tamang presyo ng mga serbisyo na ibinibigay upang pagdating po, since meron na po tayo nitong tinatawag na costing, ay makakagawa na po tayo ng provider payment mechanism na kung saan i-determine na din po natin kung magkano ang dapat bayadan ng isang pasyente. Yun po yung tinatawag natin na co-payment. Magse-set po tayo ng tinatawag na fixed co-payment.
Okay, Dr. Vargas, yung pong details na yan, you can discuss it within the PhilHealth because
Yes.
within
Okay,
the law, binibigyan namin kayo ng sapat na luwag para gawin yung tamang policy. Ang tanong ko sa inyo ganito, kanina sabi nyo, no, 3 bilyon ang nawala sa tansya ninyo on the all case rate. On the past years, nakita nyo naman yung pinakita kong COA audit reports. In the filing of the case, without necessarily pointing to anyone, willing kayo mag-sign ng affidavit kung magkano yung nawawalang pondo from 2018, 2019, nung kayo umupo, na 3 billion for 2020, I do not know, 2019, I do not know for 2018, but are you willing to sign an affidavit dun sa nawawalang pondo sa PhilHealth?
Mr. Chair, again, gaya po ng binanggit ko kanina, sa larangan po noong tinatawag nating provider payment mechanism, kami po ay nagbabayad ng fixed amount. So, sa tingin po natin, hindi po siya
Dr. Vargas, simple po yung analysis, no? Yung underpayment, wala po yun eh. No? Nagbayad kayo ng mas mababa kung ano yung dapat. Ang sinasabi natin yung overpayment. Ang sabi nyo, hindi. Hindi ba overpayment ang inyong concept? Parang kanina binanggit nyo po. Pero it's actually an overpayment. Kasi kung 15,000 ang pneumonia, nagbayad kayo ng 10, may 5,000 na umover. Particular pa ako sa mga private. Now, based on what you said kanina, because under oath ka naman, and we can give that to the courts, ngayon tinatanong kita, are you willing to sign an affidavit based on that overpayment na nakikita nyo, the 22% na lumalabas na pondo sa PhilHealth? Hindi mo naman kasalanan yan eh. But I'm asking you right now, will you help the government file that case if ever without pointing to anyone?
Mr. Chair, I am willing to help the government po. Again, just like po nang binanggit ko rin kanina because I am under oath, the data was provided to me by our
Yes, Dr. Vargas, it's all data. At makikita rin ng gobyerno yan, from the region to finance. Are you willing to sign an affidavit to that effect? Because if you will not sign the affidavit, I would think from 2018 to 2019, tinolerate nyo yan at kasama rin kayo.
Mr. Chair, I will sign an affidavit of course based on the data.
Okay. Honorable Marcoleta, please continue.
Salamat, Mr. Chair. Mr. Vargas, marami akong nabasa rin mga polyetos ng PhilHealth at dinidepensahan nga itong ACR na yan, kung tawagin nga ninyo yung all case rate. Natatandaan ko na mayroong nakalagay sa mga pamphlets ninyo na sa pagdidepensa ninyo sa argumento ng at kahalagahan ng ACR o all case rate, sabi nyo, we lose some, we win some. At pagkatapos nakalagay doon, we gain efficiency. Tama ba yung nakita kong mga paglalahad doon, Mr. Vargas, na para bang meron kayong itong sa yung all case rate, maring may natatalo kayo, meron naman kayong pinananalo, pagkatapos actually nag-gain kayo kanyo ng efficiency. Nakalagay sa mga pamphlets ninyo.
Mr. Chair, gaya po ng nabanggit natin, because this is a fixed case rate, meron pong mga pagkakataon na maaari tayong makapagbayad ng mas mababa. So, yun nga po yung tinatawag natin, you may lose in some. Or, yun pong mas mataas because it's a fixed case rate, because yun naman po yung you may win in some. However, under the principle po ng ating case rate, it works on the averages
So, you confirm that minsan manalo kayo, minsan natalo kayo. Tama?
Yes, Mr. Chair.
Okay. So, pwede mo ba akong bigyan ng example, itong committee ito? Ano pinapanalo natin?
Katulad po, Mr. Chair, ito po ay sa isang healthcare provider po, kung halimbawa po ay sila po ay nagke-claim ng 6,000, pero ang fixed case rate po natin is 8,000, babayadan din po natin ng 8,000. Kung ito naman po ang kanila pong, for example, ang kanila pong claim ay 40,000, pero
Gawin mo lang 10,000 para madali.
Opo.
10,000.
10,000 ang kanilang claim, pero ang atin pong case rate is 6,000 lang. 6,000 din lang po ang ating babayadan. And then, saan po pumapasok yung binabanggit
Dr.
natin?
Vargas, tanong lang po. Di po ba kung ako'y nagpunta ng ospital at ang case rate ay 6,000, 8,000, sabi nyo kanina, no? Example nyo, 8,000, pero po ang case rate ay, ang nagastos ay 6,000, babayaran nyo pa rin ng 8,000, tama
Yes,
po?
Mr.
Okay.
Chair, including the PF.
So, pumunta ako ng ospital, private hospital, ang babayaran ko ngayon ay 10,000. Ang babayaran nyo lang ho ay 8,000, tama?
Yes, Mr. Chair.
So, ang 2,000, manggagaling sa bulsa ko.
Opo.
O, hindi ka nakalamang, ako nalamangan. So, Congressman Marcoleta, please continue.
Yun nga tinatanong ko, Mr. Chair, paano nanalo ang PhilHealth?
Ito po ay especially po do sa ating pinalabas na no balance billing, na kung saan nga po ay hindi po dapat sinisingil na yung ating mga pasyente kahit po ang kanilang nagastos or ang nagastos na ospital ay mas malaki. So kung halimbawa po 8,000 ang kanilang nagastos, 6,000 lang ang babayadan natin, pero yung natitirang 2,000, hindi po yun dapat sinisingil sa pasyente. At ito po, nung sinimulan natin yung 23 case rates, yan po ay kasama nating ipinalabas para nga po doon sa mga kulang na ibabayad natin at doon sa sobrang ibabayad natin, siya po ay mag-average dahil hindi naman po dapat magbabayad ang pasyente. So initially, doon po yun pumapasok. Kaya po doon, kung ikaw ay mas efficient, ang pag-ooperate mo, ang pag-treat sa ating pasyente, so maaari pong may pagkakataon na yun pong kulang or yung sinasabi na labis ay siya po yung mag-average dun sa kulang naman. So yun po yung kaya po naglabas din tayo, hindi lang ito case rates, kundi naglabas din po tayo ng financial protection policy na no balance billing. However, hindi pa po, yun nga po, gaya ng nabanggit kanina ni Chair, yung ating no balance billing ay hindi pa rin po para sa lahat. Pero under the universal healthcare, sinasabi po na dapat ito ay para sa lahat at ang mga ospital ay binigyan na rin ng ilang porsyento kung gaano kadami ang dapat no balance billing or no copay at kung ilan yung dapat may copay. So doon po pumapasok yung konsepto po ng average.
Dr. Vargas, napakahaba ng kwento kasi ang tanong ko lang, bigyan mo kami ng halimbawa paano nanalo ang PhilHealth. Yun ang pinaka-particular na gusto kong ipaliwanag mo. Paano nanalo ang PhilHealth? Andyan na nga yung kalagayan ng pondo nyo. Ang sabi nga ng actuary nyo nung nakaraang pagdinig, baka 1 taon na nga lang ang buhay ng inyong, ng inyong pondo Kaya nga tinatanong ko, under the system of ACR, ang sabi nyo, you win some, you lose some. Mas particular ako doon sa ipapanalo ng PhilHealth sapagkat yan, makapagbibigay ng kabutihan sa pondo. Pag magandang pondo, mayabong ang pondo, matatagang pondo, masaya ang tao, makikinabang ang tao. Ang sabi nyo, you lose some, you win some. Ang tinatanong ko, paano kayo nananalo? Ba't kayo napunta sa ganyang kalagayan na halos malugso na pala yung pondo?
Mr. Chair,
Pinayaran ninyo ng mas mahal kasi fixed rate kesa sa medyo tumama kayo. Paano nyo masasabi ngayon in general na talagang nananalo ang PhilHealth? Pwede mo ba ngayon pangatiranan nananalo ang PhilHealth talaga kung titingnan mo yung kondisyon ng pondo? Yun ang gusto kong ipaliwanag mo.
Honorable Marcoleta, with your indulgence, pwede yung last question na yan. Meron pa ho tayong mga nakalinya magtatanong.
Gusto ko magpaliwanag siya.
Opo.
Kasi napaka-importante na ipaliwanag niya na nananalo ang PhilHealth sa pamamagitan ng all case rate. Kasi kung totoong nananalo, hindi siya nanalagay sa kanyang kalagayan na ngayon ay dinidinig pa natin sila. At pagkatapos, kung may paliwanag niya yan sana at makakatanggap-tanggap, pakiiwan niya yung telepono niya sa iyo, Mr. Chair, sapagkat isang araw, tatawagan ko siya dahil sa actual na mga kaso na inilahad ko ngayon. Kinakailangan matulungan niya yung mga tao na nagre-reklamo, baka sakaling sa ganong paraan man lang, makabawi ang PhilHealth sa kanyang imahe. Pwede bang ipaliwanag ninyo sa isang napakaikli pero masustansyang pagpapaliwanag, Mr. Vargas, kung paano sa pamamagitan ng paglipat ninyo sa all case rate ay naipananalo ninyo ang PhilHealth?
Mr. Chair,
Yes.
this is a provider payment. So dito po ay ang sinasabi po natin para sa mga ospital or sa mga provider that they may win in some, they may lose in some. Kasi nga po, ito yung paraan ng pagbabayad natin. Now, yun naman pong pagdating sa ating pondo sa PhilHealth, tama rin po kayo, tama rin po siya, Mr. Chair, sa pinapakita nila na maaaring lumaki na ang ibinabayad namin at marami din po kaming mga maaaring nagdi-defraud na ospital or providers sa amin na maaaring nagkiklaim ng mas mataas, nag-a-up case, kung kaya't yung mga yan po ay ating iniimbestigahan at yan din po ay ating pinapadaan sa legal na proseso. Yun naman pong nabanggit ninyo na sa isang taon ay maaari na lamang kaming maubusan ng pondo. Ito po naman po ay nanggaling po sa projection sa pag-aaral ng aming actuary dahil po una ay meron nga pong nangyari ngayon na pandemya na kung saan ang sinasabi po ay maaaring tumaas ang aming mga babayadan at maaari din po kaming mabawasan ng koleksyon pagdating sa premium kaya maapektuhan po yung aming pondo. Pero gaya nga din po ng nabanggit ni Chair at saka po ninyo kanina, dito po sa ating current system ay maaaring may nangyayaring fraud at itong fraud na ito na iniimbestigahan natin ay maaaring nanggagaling sa ospital, maaaring gagaling sa ating mga binabayadang providers, or again, sabi po, baka pwede ay galing din sa aming mga korporasyon or within the design of the policy itself.
Mr. Chair, hirap na hirap talaga akong maintindihan ng paliwanag niya. Ganito na lang, para matapos ako. Alin yung mas marami? Yung panalo ang PhilHealth o yung talo?
Deputy Speaker Marcoleta, parang wala naman pong naipaliwanag na nanalo ang PhilHealth.
Yun na nga eh. Kaya nga siguro, hanggang doon na lang siguro yung kanyang kayang ipaliwanag, pero ako hindi ko kayang tanggapin yun sapagkat mula sa kanila sinasabi niya, they win some, they lose some, they gain efficiency. Wala akong makitang efficiency na maski yung man lang na ipanalo eh. Ang katibayan, Mr. Chair, na walang naipanalo ang PhilHealth ay itong ginagawa nating pagdinig ngayon, na ngayon ay nagsasakripisyo tayong lahat para lang matulungan natin ang ating bayan sana, maibalik natin ang pagtitiwala sa PhilHealth. With that, Mr. Chair, sana makuha mo ang telepono ni Mr. Vargas para kahit paano matawagan siya ng mga taong binanggit po kanina, makatulong naman yung ipinangako ng PhilHealth para sa kanila. Salamat po, Mr. Chair, sa inyong pagbibigay ng panahon.
Thank you, Honorable Marcoleta. Dr. Vargas, ang isa po sa mga pwede niyong sabihin na hindi naman talaga natalo, pero parehong talo ang situation, is public hospitals. Kasi pag nagbayad po kayo ng let's say 15,000 at naging 20,000 po yung pneumonia 15,000 pero ang totoong bill 10,000, yung 5,000 na yun papasok ko sa public hospital eh. Pero yun po para pumunta lang from one public fund to another public fund. Pero in a private hospital setup, talo po talaga tayo. Pero sa katotohanan ang pasyente either way, public or private, kung ano yung ceiling ninyo, out of pocket na niyang idadagdag yun. Sa sarili niya ng pulsa kukunin. Kaya kung meron lang pong sasabihin nating tabla sa public hospital, pero sa private to talaga, nandyan yung corruption. And I see your cases, yung fraud cases ninyo, almost 5,259 ang kaso ng mga panluloko. Kasi nga, hindi lang naman to kaso ng maliit na bayad, malaking bayad sa isang maliit na panggagamot, kung hindi may nameke ng tao. Totoo po yan. At meron namang inubulang, kaya yung tinatanong kanina ni Honorable Barsaga, nagkasipon lang, gagawing pneumonia para makuha yung case rate. Kaya kung makikita nyo, yung diferensya from DOH, iba kayo parate. 500,000 lang ang pneumonia sa kanya, 700,000 sa inyo. Consistently, since 2014 to 2019. At yung katarata nga at yung iba pang madali na itagong pamamaraan para makakuha ng pera, lumalabas din ho naman sa yearly COA reports at mismong sa inyong finance kung magkano yung lumalabas na pondo sa pagbayad kung anong klaseng operasyon.
Mr. Chair.
Honorable Fernandez?
Yeah, since na nandito na rin po tayo doon sa percentage, na kanina tinanong natin kung ano yung ratio ng overpayment sa underpayment, and a while ago sinabi na 78% yung underpayment at 22% yung overpayment. At yung 22% na sinasabi kanina ni Mr. Vargas ay nagko-correspond yun sa 3 bilyon noong 2019. At we're asking also na mapadala sa atin yung mga previous years, no? And aside from that, Mr. Chairman, I think we need to find out also yung mga records ng mga different private and government hospital para ma-differentiate po natin yung kung nagtutugma, no? At considering, Mr. Chairman, that itong binanggit mo na mga kaso ng mga iba't ibang hospital, simulan po natin dun sa mga hospital na may mga kaso para makita po natin kung magbabalanse yung sinasabi nilang overpayment sa 22% na 3 billion doon sa isasubmit sa atin ng mga hospital. So, in that case, Mr. Chairman, I move that we summon also the different association ng hospitals na kung saan sila po ay binigyan ng akreditasyon ng PhilHealth and submit to us, Mr. Chairman, doon sa records nila sa underpayment na nagko-correspond sa kanilang hospital at yung overpayment na nagko-correspond din po sa kanilang pong koleksyon. In that case, Mr. Chairman, somehow mababalansi po natin kung tama yung record ng PhilHealth at tama rin yung record ng mga different hospitals, Mr. Chairman.
Yes, thank you.
I so move, Mr. Chairman.
Thank you, Deputy Speaker Fernandez. Kung papayagan niyo po, Deputy Speaker Fernandez, dito po sa mga may fraud cases, since 2018 to 2020, yan po yung unahin natin. Tapos hingin din po natin yung data ng mga malalaking alokasyon.
So, Mr. Chairman, ang sinasabi mo po ninyo, do sa 2018 po na under at overpayment, they need to submit all those documents coming from the different hospital. Ito kasi yung mga fraudulent na mga hospitals na may mga kaso.
Ano po natin, ipa-check natin sa committee kung particular ano po yung mga hospital na to. Kasi yung iba nakita ko, and review ko mga pa isa-isang kaso. But marami din dito yung maramihang kaso sa bawat hospital. But anyway, Deputy Speaker Fernandez, your motion is to, if you want, no, let's focus on pneumonia at sino yung mga private hospitals na malaki ang binayaran.
I think, Mr. Chairman, yung 5 pinakamalalaki na package,
Okay.
siguro i-categorize natin yung 5
Okay.
sa bawat hospital na isubmit sa atin yun para ngayon makita po natin ang difference, Mr. Chair.
The committee secretary is directed to look into the list of the cases, fraudulent cases, na nandito po sa atin from 2018 to 2020, and the list of 2013 to 2020, if PhilHealth can give us kung ano po yung malalaking private hospitals, top 5, na nag-benefit dito sa, let's concentrate on pneumonia, because ito yung malaking ginagamit. PhilHealth is so directed, and the committee secretary is so directed.
Mr. Chairman.
Yes?
Ace Barbers.
Honorable Barbers is recognized.
Salamat, Mr. Chair. Mukhang there's some technical problems. I've been raising my hand earlier. So, anyway, gusto ko lang kasi sanang magkaroon ng interjection dun sa tanong ni Congressman Marcoleta. Tungkol dun sa punto na merong overpayment. May underpayment daw na 78%. Eh kung may underpayment na 78%, di sana nag-welga na yung mga ospital. Hanggang ngayon, mukha namang hindi. But yung 22% na overpayment, mukhang tahimik. Of course, we understand why they are probably quiet dahil nga nakinabang sila. Yung tanong ni Congressman Marcoleta tungkol dun sa mga packages kasi, Mr. Chair, who determines kung how much should the package be, how much is the net amount that will go to the doctor for its professional fees, how much will go to the hospital, etc. etc. Yung kakabuuan po ng package, sino po nagde-determine nun?
Mr. Chair, Mr.
Yes.
Congressman, we have a department in the corporation, the Benefits Development and Research Department, who does the research and who proposes the policy and actually to compute also on this.
Let's say, take the case, for example, of an opta or an eye doctor, no? Nag-opera siya. Example lang, how much, di ba sabi natin isang mata, 16,000, am I correct?
Yes, Mr. Chair.
So, dun sa 16,000 na yun, o sa dalawang mata ay 32,000, yun nga yung nasa case rate ninyo. How much, more or less, is the net amount that goes to the professional fee of the doctor? Para lang may idea tayo.
Mr. Chair, for a while lang po, I'm checking lang po.
Sumagot ka
this
ng,
Apo.
tama naman, wag naman yung masyado maraming pasakalye. May mong paligoy-ligoy kasi, Mr. Chair.
Mr. Chair, for example po dun sa cataract, we pay po for the hospital 9,600 and for the professional fee, it's 6,400.
6,400 is the net professional fee that goes
Yes
to the
po.
doctors
And then
for
for
both eye operations. Eye cataract.
Ang rule po, Mr. Chair, sa cataract is kung ito po ay gagawin in one sitting for both eye, we will only pay po 16,000. Pero kung ito po'y gagawin with a difference of 24 hours, saka lang po tayo magbabayad ng dalawang pakete. Pero yun nga po, 9,000, roughly pagka po surgery, dun sa case rate, 60% po ay pupunta doon sa hospital, the 40% is pupunta sa Sorihano. Pagka naman po medical case rates, ito po ay 70% for the hospital and roughly 30% will go to the doctor.
Honorable Barbers, if I may, we still have people lined up. Kung okay na po yung clarification.
Isa na lang, very short, Mr. Chair, kasi kanina, yung sa, tungkol din sa case rate, I will again ask anyway sa IRM later on. Yun na lang, kasi nga, napupunta dun sa professional fee, napakaliit na amount, no, considering that we're charging 32,000 and yet what goes to the doctors for their professional fees just net of about 6,000 pesos. So meron and probably this is one of the reasons why doctors opt to become nurses abroad. They travel out of the country because of this. So having said that, Mr. Chair, I will go into other details with respect to the IRM if there will be a second round. Thank you, Mr. Chair.
Yes, Honorable Barbers. The IRM will be taken up after this. The Honorable Congresswoman BH, Congresswoman Bernadette Terena is recognized.
Yeah, thank you very much, Mr. Chair. Magandang hapon po sa inyong lahat. Thank you. Gusto ko lang po i-follow up yung aking hiningi last hearing na nagtataka ko na a lot of our fellow legislators are asking the same questions. And I would like to reiterate, nasubmit na po ba yung hinihingi ko na proseso and guidelines as to how PhilHealth decides kung sino ang mga binibigyan ng ating IRM. I remember last week hiningi ko po ito, hoping na bago itong hearing na to ay nasa akin na ang proseso at guidelines, pati na rin kung sino yung 770 something na institutions na nirelisan ng IRMs na ito. So I'd like to know, Mr. Chai, nag-submit po ba sila sa committee?
PhilHealth.
Mr. Chair, may we just check from our legislative if they have complied with the submission? Mr. Chair, according to them, yes daw po.
Before you proceed, Honorable BH Herrera D, is the Senior Vice President Del Rosario also Jojo Del Rosario? Is that his name?
His name, Mr. Chair, is Rodolfo
Yes, but is his nickname
Del
Jojo Del
Rosario
Rosario?
Jr.
Is that his nickname, Jojo Del Rosario?
Yes, Mr. Chair.
Comsec, can you please check the page of Mr. Jojo Del Rosario because he posted something at 2:25 in the afternoon. Nung naghahanap tayo dito na makakipag-usap at magsasalita, wala siya dito pero nakapag-post siya sa Facebook ng isang message. At any rate, Comsec, kindly look into this ASAP. Honorable Congresswoman BH Bernadette Herrera D, please continue.
Yes, thank you, Mr. Chair. Can I get confirmation from the Committee on Public Accounts or Good Government kung nag-submit nga po sila and tama po ba yung sinubmit na data ng PhilHealth? Mr. Chair?
Go ahead.
Nakasubmit po ba sila? Natanggap po ba ng committee?
Comsec is recognized. Kindly reply to the Honorable Herrera D.
Anyway, Mr. Chair, pag meron po, pakisubmit lang po sa aking opisina para naman may kopya din kami. But I'd like to ask na lang a question. So ano po yung nagiging basehan kung bakit mas marami ang pribadong ospital ang nabibigyan ng IRM kaysa sa mga pampubliko? Ano ang main guideline na sinunod nila kung bakit mas madaming napagbibigyan na pribadong kumpanya?
Mr. Chair, wala po tayong pinipili kung ito ay pribado or publiko. Ang pag-aaproba po ay depende po doon sa kung sino po ang makapagbigay ng kompletong dokumento kagad from the regional office papunta po sa central office. So
Requirement, sige po, patuloy po.
Opo, Mr. Chair, so again, depende po kung kailan po siya na-receive, at yun po, and then kung kailan po siya marirelease. I think we have the data also, Madam, Mr. Chair, when we receive the complete documents and when we actually released or approve the IRM.
Nagdo-due diligence po ba tayo kung ang mga kumpanya ay SEC-registered, mga active na businesses, or sila ay mga nagbabayad ng mga buwis sa ating gobyerno, at sila ay mga good standing businesses sa ating bansa?
Mr. Chair, Madam Congresswoman, sorry po. Is this aligned with dun sa release po ng IRM or as a general process?
Sa IRM. Well, sa IRM. Sa general ano ba yan? Dapat ba accredited sila sa IRM? Meron bang accreditation process? O namimili lang kayo ng ibang ospital? Kung sino lang nag-submit sa inyo, pwede bang mag-submit ang lahat ng ospital?
Opo. Hindi po, Mr. Chair, hindi po tayo namimili. Again, ito po ay nakabase po doon sa database na meron po kami. Kung ito ay accredited, chinecheck din po natin. Tapos hindi, pero doon po sa binabanggit nyo kung ito po ay registered o hindi, because sa anim naman po ang ating requirement para ma-accredit is meron pong Department of Health license. So kasama po yon sa atin pong mga chinecheck.
Ang business permit po ba kasama sa requirement ng Department of Health license?
Mr. Chair, Madam Congresswoman, I will have to check on that po.
So,
If the business permit is a requirement of the DOH license.
Registered sa isang lokal na pamahalaan bago kayo ay mag-release ng pondo sa kanila?
Mr. Chair, again, kasi po doon sa atin pong tinitingnan ay kung ito po ay accredited, ito po ay maaari nating mabigyan. And,
so it doesn't matter kung sila ay rehistrado sa lokal na pamahalaan o hindi?
Mr. Chair, with the license po, we assume that they are.
So hindi kayo nag-due diligence? You cannot assume. You are giving billions and millions of pesos to hospitals. Do you mean to tell me you just assume na sila ay in good standing at maayos at pwede nating bigyan ng limpak-limpak na salapi?
Mr. Chair, Madam Congresswoman, again, because we have the accreditation, and with the accreditation, there are documents including the DOH license, then yun po ang atin pong requirement. And at the regional office po, sila po ang nag-check as part of our guidelines. Sila po yung nag-check on the eligibility of our facilities because again, there is a MOA there is a letter of intent and there is a memorandum of agreement before we can release.
So, ibig sabihin, hindi ba sa tingin mo, hindi ba tamang requirement na registered business sa isang local government ang isang institusyon para sila ay mabigyan ng IRM?
Mr. Chair, Madam Congresswoman, sorry po, pakiulit lang po.
So, sa tingin mo, hindi tama na may requirement na tignan kung sila ay legitimate business existing in a local government bago sila mabigyan ng advance na pera mula sa gobyerno or mula sa PhilHealth?
Mr. Chair, Madam Congresswoman, again, ang amin pong basis would be the accreditation and of course later on, ay yun pong license as a requirement pagdating po sa accreditation.
Well, that's why, again, I would like to see that guideline or yung inyong listahan. May tanong po ako, sa pribadong institusyon, pag nagbigay tayo ng IRM, for example, sa isang dialysis center, ang assumption natin dito ay libre po ba nilang ibibigay ito sa mga beneficiaries ng PhilHealth na nagpapadialysis? Paano po ba yung sistema? Please enlighten me.
Opo, Mr. Chair. Ganito po, yun pong ating ibinibigay na IRM as a whole ay again as a prepositioned amount because of the pandemic. So, ang mangyayari po noon, that is to make sure that the facilities are able and continuously able to provide the services, yun nga po, because brought about by because of the pandemic. So, mangyayari po noon, yun pong mga serbisyo na ipinoprovide ng isang pasilidad, sila po ay magpa-file ng claim sa atin for all those services, at doon po naman, sa mga serbisyo po na yun, or doon sa claim, doon po natin ngayon ibabawas or ililiquidate yun pong amount na naibigay po natin.
Pero is it supposed to be 100% free or may dinadagdag silang additional na presyo doon sa kanilang singilin pagdating sa pribado?
Pagdating po sa pribado, Mr. Chair, pagdating po sa pribado, maaari po talagang merong masisingil ang ating mga ospital, especially nga po kung ito'y above the case rate. Pero kung ito po halimbawa, katulad sa proviso natin ngayon, doon sa ating COVID packages, yan po ay no co-payment. Kahit po sa gobyerno or sa pribado, yan po ay no co-payment, especially po doon sa ating identified standards.
May katulad to, gusto ko maintindihan kasi nakarating sa akin na ito palang Bibron na binigyan ng PhilHealth ng 45 million ay naniningil sa kanilang dialysis patients kahit PhilHealth members. So, ano ba dapat ang sistema doon sa bagay na yun? Pero nabigyan naman ng 45 million ng PhilHealth sila, pero nabalitaan namin na binabayaran naman pala ng mga dialysis patients ang serbisyo nila.
Mr. Chair, Madam Congresswoman, the package po ng ating dialysis so far is at 2,600. So, although it is repetitive, so yun po, ngayon kung meron pong naniningil in excess of the 2,600, Mr. Chair, Madam Congresswoman, I will just have to check lang po if the dialysis clinics in itself is a no balance billing facility. I will get back to you po to technically respond on that.
O kasi gusto ko yung maintindihan eh. So you allow private facilities na sinasubsidize natin. So, kumbaga, hindi natin tinutulungan yung pasyente, sinasubsidize lang natin yung bayad nila, pero nagbabayad pa rin yung mga pasyente. Hanggang magkano ang ina-allow nyong singilin ng mga private clinics na to? Hanggang magkano? Kung sinasabi mo, allowed silang magpatong doon sa 2,600 na binibigay ng PhilHealth. Hanggang magkano? Kahit magkano, pwede nilang ipatong?
Mr. Chair, sa ngayon po, in general po, ang atin pong polisiya, doon sa merong fixed co-payment, ito po yung sinasabi natin na hanggang magkano lang yung pwedeng singilin, ay nakapaloob pa lamang po doon sa tinatawag natin na Z-benefit packages. Yun pong pagtatalaga ng fixed co-payment ay atin pong mailalagay kapag ka po nakuha na natin yung tamang costing ng services being provided. And it is not only for the private but also for the government. So yun pong fixed co-payment sa ngayon po ay again dun pa lang sa Z-benefit packages. Pagdating naman po, and that is the time po that we can actually say na dapat ay ito lang yung pwedeng singilin. So sa ngayon po, wala pa rin po kaming regulasyon pagdating po doon sa magkano ang pwedeng ipatong or magkano ang pwedeng i-charge, especially ng mga private healthcare providers. Pagdating lang po dun sa dialysis, ma'am, again, I will check if it's a no balance billing policy.
So, Doc, hindi man lang ba natin naisip na isa sa mga kwalifikasyon ng bibigyan natin ng advance payment ay yung mga clinics at hospitals na willing magbigay na ng libre? Bakit pa natin papadagdagan sa kanila? Hindi ba pwedeng maging kasama yun sa kondisyones natin na, sige, kasama kayo sa bibigyan ng advance payment ng gobyerno kung sakasakali mang allowed ito on the condition na hindi na kayo magpapataw ng additional. Diba? Kasi yun ang dapat tinutulungan natin, yung mga ospital na willing tumulong sa mga kababayan natin. Hindi man lang ba sumagi sa ating isipan na mamili ng mga ospital on the basis of those who can give this service for free?
Mr. Chair, tama po kayo and we agree. However, sa kasulukuyan pong polisiya ay hindi nga po yan nasusulat, pero tama po kayo na maaari po nating mapag-aralan pagdating po sa inyong sa inyo pong suggestion.
Well, medyo tagilid pa kasi yung ating legal basis nung ating IRM, kaya hindi ko rin malaman kung ito isang bagay na pagpapatuloy pa natin dito sa gobyerno. Pero sa ngayon, gusto ko lang linawin, nakatigil lahat ng IRM natin. Tama? Doc, nakatigil naman po lahat, suspended lahat ng issuances ng IRM natin. Is that correct?
Mr. Chair,
Dr. Vargas, tama po ba? You already have 14 billion. May na-release na 14 billion.
14.9 billion po, Mr.
Okay,
Chair.
14.9 billion na Congresswoman BH ang naka-release sa mga ospital.
Opo, pero hindi na tayo nagre-release pa as of now. Nakasuspend tayo kasi I think ang budget nila dyan is 37 billion, if I'm not mistaken, Mr. Chair. I'm just worried na baka mamaya nagtutuloy-tuloy pa rin, nagpa-facilitate at nag-accredit ang PhilHealth ng bibigyan ng IRM.
Dr. Vargas?
Mr. Chair, Madam Congresswoman, 27 billion po. Tapos sa ngayon nga po, gaya ng nabanggit natin, ay nag-scale down na po ang management with regard to the release of IRM, especially for those facilities with COVID patients. And ngayon po ay kasama sa requirement bago po makapag-release ng IRM ay yun pong report coming from the regions with regard
Dr. Vargas,
to the status of COVID patients.
Ang tanong po ni Congresswoman ang tanong po,
clarify po, scale down, ibig sabihin, it's still continuing. Kailan yung huling release natin sa isang ospital, Mr. Chair? Through you, Mr. Chair. Gusto ko lang po na-alarm lang po ako doon sa scaling down. Ibig sabihin, we are continuing to release.
Dr. Vargas?
Mr. Chair, I'd like to check lang po if you would allow with our finance with regard to the kailan po yung huling release or disbursed.
Ang una pong tanong ni Congresswoman Bernadette T. is tuloy-tuloy pa po ba?
Mr. Chair, Your Honor, ang last po na release ng IRM po natin sa tanda ko po ay July 23 po. And I think this will be raised to the PhilHealth Board po ang tanong ni
Okay,
Congresswoman.
so July 23 ang huling release at hindi muna tayo nagre-release.
Yes po, yung nang tanda ko, Mr. Chair, and I think this will be raised to the PhilHealth Board po. What would be the action of the board, instruction of the board, whether to continue or what action po ang kailangan gawin po dito.
Honorable Congresswoman BH?
Thank you. So yun lang, I would just like to make that clear that there will be no releases until the board takes action. And I think this committee also, Mr. Chair, maybe through you, we could also tell the board na until everything is sorted out, I don't think it's right to release, to continue doing so. Dahil as nakita naman natin, hindi pa rin natin na-establish yung legal basis nito. Dahil yun ang sinasabi pa ni Senator Ping that I'm still not clarified na nauna ang resolution or nauna ang circular bago sa board resolution. I would like to be clarified on that one. I don't know if it was discussed kanina, Mr. Chair. Gusto ko lang pong malaman kung ano yung sinasabi nila. Kasi nung time na nagtanong ako, ang basis na ginagamit ni General sa akin was the RA. But apparently, there was a circular and a board resolution na tinutungtungan dapat ng IRM na ito. na
Yes.
point out niya na nauna pa ang circular bago ang board resolution. Can we be clarified on this
Yes.
one?
Congresswoman BH Herrera D, ang agreement po sana sa IRM is we take it after the all case rate issue.
Okay. Sorry, Mr.
Opo.
Chair. Okay.
Pero okay lang naman po, Congresswoman BH, if you may wrap up your line questions. Maraming salamat po.
Okay, Mr. Chair, so I will wrap up na on the IRM. If I hope, Mr. Chair, na maka-question ako tungkol sa IRM on the next hearing. At sana po malaman po namin kung kailan yung turn namin, Mr. Chair, para naman po alam namin kung kami po ay may pagkakataong magsalita. With regards to the all cases, so we are limited, as I understand, Mr. Chair, for this hearing, we are just limited on the all case rate issue. Ganun po ba yun?
Yes, Congresswoman D.
Would we have another hearing on the computer issue naman po, on the IT?
Yes, Congresswoman D. In fact, I just have, ngayon lang po tayo nagkaroon ng confirmation. On Monday and Tuesday, we will have a hybrid session on this, a continuing session, which will include yung pong IRM and the computerization. Congresswoman
Thank you.
BH.
So I will wrap up because my concern is mostly on the IRM and the computerization. Siguro my last question na lang, doon lang sa all case rate, is that isa po sa nakikita kong naging problema ng all case rate, and maybe it has been discussed a while ago, is the upcasing of claims. Marami po bang naging surges nito sa inyong obserbasyon, Doc? Yung pagdating doon sa upcasing na hanggang ngayon po kasi, like kahapon lang, ako po ay nakatanggap ng tawag mula po sa aking pinsan na pinipilit po sila ng ospital na i-declare na COVID patient yung pinsan ko. Kahit wala pa yung COVID results. And I think we know one of the reasons is because of this case rate system. Why is it still happening? With all these hearings, hindi pa pinagsasabihan ng PhilHealth or wala bang ginagawa yung PhilHealth? Kasi apparently, it's still happening in all hospitals sa pinipilit nilang patanggap o COVID patient yan kahit wala pa ang resulta ng COVID test result.
Dr. Vargas.
Mr. Chair, Madam Congresswoman, yes, Madam, I think it is still happening. That's why nga po, there are still cases which are being heard and investigated right now by the corporation. Yun pong tinatawag natin na upcasing. Opo, maaaring nangyayari pa rin po ito sa ngayon.
So, ano kayang pwede nating solusyon doon agad-agad? Pwede ba silang hindi makapag-claim ng kanilang all case rates pag ganyan? Para nang sa ganun, matakot naman itong mga ospital na to na pinipilit pa rin ipilit yung sakit dahil mas madaling kumulekta. Sana naman nakikita po ninyo yung nangyayari sa mga ospital ngayon. They want to make use of one sickness kahit hindi yun ang sakit ng isang tao just to be able to collect from you. Pero hindi naman niya dinidiscountan yung kanyang mga pasyente. Yun yung pinakamasaklap doon. And these are very real instances. Yung hospital po na sinasabi ko ito ay Capital Medical Center. Yan po ay isang sinumbong sa akin na pinipilit nila na sabihin COVID patient na lang daw po ang aking pinsan kahit na wala pa ang kanyang COVID result. So I would like you to take a look at that. Please get in touch with me. I'll be more than happy to supply you with information regarding this matter. These are very real situations and it's not just happening in Capital Medical Center. It happens in a lot of other hospitals as well. And this is because of this all-case rate system that you have in place right now in PhilHealth.
Yes, Mr. Chair. Yes, Madam Congresswoman, we would be very happy to coordinate with you. And sa ngayon din nga po, maliban po dun sa inyong nai-report, ay meron na rin pong ilang lumalabas na report katulad po dun sa nasa social media na meron nga pong maaaring mga nag-a-up case na para makapag-claim ng COVID. And again, gaya po ng ginagawa namin sa ibang kaso, pinag-aaralan na rin po natin na pagdating po dito sa COVID, meron din po tayong tinatawag na medical prepayment review para hindi po ito babayadan kaagad-agad but rather magkakaroon mismo ng medical evaluation para makita kung ang treatment na nangyari or management is really for the COVID. Kasama rin po sa ating maaring tingnan na ngayon ay yung nire-require po natin na itemized billing charges sa isang ospital sa isang pasyente para makita rin po natin kung ang sinisingil ng mga ospital na ito ay talagang naaangkop doon sa paggagamot ng isang COVID case as per guidelines. We will be coordinating with your office, Madam Congresswoman, for this.
Yeah, but through you, Mr. Chair, can we get a concrete step from PhilHealth as to how we can avoid these things already? I hope by the next hearing, meron na po kayong konkretong mga hakbangin kung paano, number one, hindi na dapat maiwan ang sukli sa mga pribadong ospital dahil hindi naman po ito nakakatulong sa mga miyembro ninyo. Tandaan po natin, mga miyembro po ang inyong pinagtatrabahuhan, hindi naman po ang mga ospital. Ito po ay yung mga miyembro na pinaghihirapan po ang bayan. Kaya katulad ng sinabi kanina ni Deputy Speaker Marcoleta, that's technical malversation dahil hindi niya na ibabalik sa gobyerno yung perang ito. So number one, sana may konkreto kaagad kayo kung paano hindi kailangan maiwan ang suklet sa mga ospital. At number two, kung paano hindi man mamaneobra o mamanipulate ang upcasing ng iba't ibang cases na nire-report nila just so they can take advantage of the rules of PhilHealth. I hope through you, Mr. Chair, on the next hearing, they can submit concrete steps on how they can address this situation.
Maraming salamat, Honorable BH, Congresswoman Bernadette Herrera D.
Mr. Chair, last na lang po, Mr. Chair, if I may. Mr. Chair, for your next hearing next week, I hope that we could, if pamarapatin po ng ating magandang chairman, sana po maipa-post naman po natin sa secretariat kung ano po yung pagkakasunod-sunod ng interpellators so that all of us naman po are apprised kung pang ilan na po ba kami, because I have been asking this morning pa kung pang ilan ako, nasaan na ba ako sa listahan, kung ako ay nalista na, ngunit wala po akong nakukuhang kasagutan. And I would appreciate that, Mr. Chair, for the transparency naman po para po sa aming nasa Zoom, sana po mailista po natin sa ating chat group kung ano na po yung listahan ng interpellants po natin. Kung inyo pong mamarapatin, Mr. Chair, maraming salamat po at marami pong gustong magsalita at makibahagi po dito sa ating committee hearing.
Thank you, Honorable BH. I apologize for that kasi po nangyari, initially it was just my committee. Naging joint po tayo eh. Kaya meron din po listahin yung kabilang committee that we had to integrate together. If you recall, nung una nating hearing, it was the public accountability, pero tama po kayo, nung pumasok na tong question ng hospitals, nagtawag na po ng joint committee hearing. So I apologize for that. Wag ko kayong maglala because I have here the list of those who will be asking questions. Ipopost ko po dun sa thread natin. So thank you, Honorable...
Maraming salamat po, Mr. Chair. Thank you very much po.
Thank you so much, Congresswoman Bernadette Herrera D. We now proceed
Mr.
to...
Mr. Chair.
Yes, if I may, kung maaari po sana, no, we have a deadline, may curfew po tayo. I will limit the questions doon sa ating mga kasama ng natitira, Congresswoman Dasa, Garin, Kimbo, and Gasataya to 15 minutes. So with that, yes, PhilHealth, VP Limsiaco.
Mr. Chair, I stand corrected. The last payment na released po natin sa IRM, it was July 21 po.
July 31 was the last payment of the IRM payment or IRM release.
Release po ng IRM po.
IRM release. So, this last July. So now we proceed to, thank you, Congresswoman Bernadette Herrera D. Congressman Dasa is recognized. Congressman Paul Dasa is recognized. Okay, we now proceed to the Honorable Janet Garin, who's still with us in plenary. Our senior Minority Floor Leader, Congresswoman Garin, is recognized. Okay, while waiting for the Honorable Garin, may we call on the Honorable Kimbo, who's still with us in Zoom. Congresswoman Kimbo is recognized.
Thank you, Mr. Chair. Can you hear me?
Yes, very clearly. Go ahead.
Dr. Ish, good evening po.
Mr. Chair, good evening po, Madam Congresswoman.
So, nabanggit mo kanina, Doc, na ang overpayment is 22% of your case rates and then the underpayment naman is 78%. Tama po, no?
Mr. Chair, Madam Congresswoman, yes po, as reported.
Alright, and which means because 22 plus 78 equals 100, zero po ang case rates na correctly computed. Tama?
Mr. Chair, Madam Congresswoman, may I refer po to our actuary who provided the data, sorry.
I guess, Doc-ish, I don't even need an answer for that because 22 plus 78 is 100. So, ibig sabihin nun, wala kang case rates na tama. So, balikan natin ang ibig sabihin ng overpayment. Ibig sabihin na yung case rate exceeds the costs. Ibig sabihin, kung hospital ako po ay kumita. Tama po? May profit doon sa case rate na yon.
Mr. Chair, yes po.
Pag sinabi naman underpayment, ako naman po ay nalugi. Ibig sabihin yung natanggap ko sa PhilHealth ay mas mababa sa aking costs. Tama po?
Yes, Mr. Chair.
So, ang ibig sabihin nun is the implication of your overpayment and underpayment is not really on the fund viability of PhilHealth, but rather on the profitability of the hospitals. Tama, di ba?
Yes, Mr. Chair, yes po. However po, of course, it is also a cost containment for the health insurance because again, if it is being, if the principles are being followed, then again, it's a pwede po siya maging cost containment as a provider payment mechanism.
Tama po, but the cost containment is happening at the hospital side. Ito na nga po yung kanina pa pong sinasabi nila Chairman Mike, na ang implication is not on your fund, but rather on the hospital. Tama po? So, anyway po, which means, di ba, na kapag public hospital, no, kapag may overpayment siya, kailangan niyang tipirin yon because 78% of the time naman, siya ay lugi. And because there's a no balance billing policy, ibig sabihin, hindi siya pwedeng sumingil ng dagdag doon sa pasyente. Diba? So in other words, kailangan niyang punuan ang kanyang lugi doon sa underpayment na 78%, doon sa nakuha niyang overpayment na 22% of the time. Tama po?
Chair, tama po.
And in other words, kung kulang pa, kailangan nang humingi ng subsidies ang hospital, and usually that is from the MAIP, yung Medical Assistance for Indigent Patients. Tama po?
Tama po.
Pagdating naman sa private hospital, doon may problema kasi pwede kang mag-balance billing. So, ibig sabihin, kapag underpayment ang nakuha mo from PhilHealth, pwede mong singilin yung kulang doon sa pasyente. Tama po?
Tama po.
In other words, sa private hospital, panalo parate. Kasi 22% of the time may overpayment, which means may kita siya. Pagdating naman sa 78% of the time na underpaid siya, pwede naman po niyang singilin ang pasyente. So in other words, ang sistema na ganito always assures hospitals that they can make some profits. Tama po?
Tama po.
Except for when hindi siya makasingil sa pasyente. That's the only problem. Diba? Kasi ibig sabihin, there are some situations na talagang hindi naman makabayad ang pasyente for those 78% case rates na under ang payment. Diba? So in which case, lugi siya. Kailangan niya i-absorb yung lugi. Tama, di ba?
Yes po, Mr. Chair.
So, ito sa tingin ko yung problema. Kasi kapag 78% of the time, lugi ang isang hospital, hindi pa maghahanap siya ng paraan para habulin yung kita. And kapag mahina ang control sa fraud ng PhilHealth at may opportunities to engage in that kind of fraudulent behavior, dito tayo nagkakaroon ng problema. Tama po?
Tama po, Mr. Chair.
So, yan sa tingin ko nga ang aking frustration. No? Dahil ako po, ulit bilang isang health economist, alam naman natin, Doc, may advantages ang case rates kumpara sa fee-for-service. Because fee-for-service, in theory, if perfectly implemented, and gano'n din ang case rates if perfectly implemented, mas lamang ang case rates because it rewards the efficient. Diba? Meanwhile, ang fee-for-service naman rewards the inefficient. Kaya pag nag-uusapan ng efficiency, maganda sana ang case rates. However, because mali-mali ang case rates ng PhilHealth, diba? 0% of your case rates are correctly estimated. Nagkakaroon tayo ng napakalaking problema. And the big problem really is nagkakaroon talaga ng incentive na mag-engage in fraudulent behavior ang ating private hospitals. So, yan po ang aking observation. Doc, is this something that, would you share that kind of an assessment?
Mr. Chair, Madam Congresswoman, tama po kayo because for one, we really need to make the proper costing of healthcare services in order to make sure for us now to one, provide a policy that will actually, yun po, mas mapapasunod natin yung magandang polisiya sana ng case rate because with that also, we can actually demand for the other for the fixed payments or we can not regulate but we can provide all those other advantages na makukuha ng miyembro dapat kung tama po yung ating naging costing doon sa tinatawag nating case rate. Pero sa ngayon po, ang sinasabi nga po ay napakababa pa niya at kailangan po siyang ma-review. Which right now, Mr. Chair, yan po ang ginagawa natin sa PhilHealth, yung pong pagko-cost, and currently we have the costing framework and we are soon to come out with the costing. However, with the costing exercise, hinintay lang po natin yung system para po magamit para dito.
So, pero kanina niyo pa sinasabi, Doc Ish, na naniniwala kayo na may fraudulent behavior dito sa ating sistema. Tama, no?
Yes po.
Ano ba ang iyong theory kung paano nangyayari itong fraud?
Well, for one po, katulad halimbawa ng mga nababanggit na merong app casing. So, pagdating po sa ospital, yung pong mga binabanggit ay may mga maaaring ubo or sipon na ang mga ospital ay magkiklaim ng mas mataas na case rate para sa kanya. So, katulad po noon, kung kaya po sa ngayon, ang PhilHealth po pagdating halimbawa doon sa pulmonya na may pinakamalaking binabayaran ng PhilHealth, kami po ay naggagawa ng tinatawag na prepayment review. Meron na rin po tayong ginagawa ngayon na medical evaluation for them. Meron po tayong mga admissibility criteria. May sinusunod po tayo dito. So ngayon po, pagka po meron tayong nakikita na findings for those, ito po ay nire-refer natin to our legal kung ito po ay nakikita natin na may bahid na fraud, and of course, the legal process will follow. So yun po isa sa example.
Ang pneumonia ba ay kasama dun sa 22% na overpayment?
Mr. Chair, Madam Congresswoman, I will have to ask our actuary, again because the data came from them, what are the cases actually included in the supposedly overpayment and even the underpayment.
Kasi ang gusto ko sanang sabihin, Doc Ish, is because if 78% of the time, lugi ang isang ospital, at kailangan siyang habulin, at at maluwag ang sistema ng PhilHealth at maraming opportunities for fraudulent behavior, baka naman bawiin po yan doon sa cases na may overpayment. Kaya gusto kong malaman po, no, ano-ano bang cases dyan dun sa 22% na yan? Kasama po ba dyan ng pneumonia?
Mr. Chair, Madam Congresswoman, we will get the details po kasi sa ngayon, what we have as summary, yung po aggregated. So, we'll dig deeper into the overpayment and underpayment po, Madam Chair. Madam Congresswoman.
Madam, actually, itong listahan po, ha? Mr. Chair, is it possible for me to share a screen?
What's that, Honorable Kimbo?
Can I share a screen, Mr. Chair? Ayan po, Mr. Chair, gusto ko sanang dagdagan lang po yung sinabi ninyo kanina about comparing the number of PhilHealth claims for pneumonia with itong DOH data. Nabanggit niyo na po, Mr. Chair, kanina na in 2018, ang PhilHealth claims is 757,000, pero ang ayon sa DOH, ang tao lamang na may pneumonia noong 2018 ay 503,000. So itong difference po na 757,000 minus 503,000, which is about 253,000, baka ito na po yung tinatawag na ghost claims o di kaya upcasing. No? Ibig sabihin ng ghost claims is wala naman pong pasyente na may pneumonia, pero for some reason ay pumasa sa claims processing ng PhilHealth ito at nasama po siya sa pagbayad ng claim. O di kaya hindi naman pneumonia ang sakit dahil ang sabi ni Doc Ish kanina, chest x-ray lang ang kailangan. But in many cases po, pati CBC kailangan eh. Kailangan din ng blood test para malaman kung talaga may pneumonia ang isang pasyente. So, ito po ba, Doc Ish, is a possibility na ganito kalaki? 253,000 ang excess claims. And if we multiply that by the average value of PhilHealth claims for pneumonia, which is 14,445, ang value po niyan is 3.6 billion pesos. So meron po, in 2018, may posibilidad na nawalan po tayo ng 3.6 billion pesos nang dahil lamang sa pneumonia. And,
Honorable Kimbo?
yes.
Yes. Dito po sa pinakita mo, ang sinasabi mo dyan, yung ghost, na talagang walang tao, ginawan lang nila ng claim. Pangalawa dyan, yung wala talagang pneumonia, pero ginawan lang pneumonia.
Tama po, Mr. Chair, baka nauubo lang or may sipon, pero classify na pneumonia.
Opo,
diba? Dahil
pero
kahit nga kanina si Doc Ish, hindi niya malaman kung required bang chest x-ray. Pero matik yan sa mga doktor na mga mahuhusay na you need a chest x-ray and a blood test to determine kung may pneumonia ang isang tao.
yes,
And,
at
if I may share,
the Honorable Kimbo, yeah, dagdag lang ho. Congresswoman Kimbo?
yes, Mr. Chair.
Yes. Doon sa 500,000 na maaari talaga pumasok sa PhilHealth, iba pa ho yung overpayment. So tatlo po yan. Overpayment, ghost, and upcasing.
Tama po yun. Pero dito po, hindi ko na kinonsider ang overpayment as fraud. Pwede natin i-consider yun as inefficiency, pero sa tingin ko po, baka hindi fraud ang tawag doon. Pero tama po kayo, Mr. Chair. That's also the third problem. Kaya ako tinatanong kanina kay Madam actually, kung ang pneumonia ba ay kasama doon sa 22% na overpayment po na case rates. And Mr. Chair, if I also may share with you, pag titignan din natin ang data in the past, ito na po ang aking computation, 2017, following the same method, 5.3 ang maaaring nawala. Noong 2016, kahit paano, tila walang nawala dyan. Ibig sabihin, yung number of claims would be less than the number of supposed people na merong pneumonia. Pagdating ng 2015, may 5 billion na possibly nawala. Pagdating ng 2014, about 1.3. So pag susumahin natin itong 5 years na to, that's about 15 billion pesos, Mr. Chair. So, yun lang pa, I wanted to share that. Ito po ang isa pang concern na gusto ko sanang i-raise sa inyo. When I was computing itong possible leaks, no, napansin ko po na ang ginamit ko na number na PhilHealth claims is from the official report of PhilHealth. Ito pong tinatawag nilang stats and charts. So Doc Ish, can you please confirm na tama naman ang aking pinagkukuhaan ng datos pagdating sa claims? Yung tinatawag na PhilHealth stats and charts. Tama po ba?
Mr. Chair, yes po, yung pong stat and charts, yan din po ang nakalagay po sa ating website.
Okay. Pero po, nung ako po ay sumulat sa PhilHealth at sila po ay sumagot sa akin at binigyan po ako ng datos para sa pneumonia claims ng 2018, doon po sa kanilang submitted data sa akin, ang total number of PhilHealth claims ay 870,000 po. So, mas malaki. So, yan ang tanong ko sa inyo, Doc Ish. Ano bang paliwanag dyan? Bakit magkaiba po? Dahil malaki ang implication. Kung talagang 870,000 ang claims noong 2018, ang possible fraud, ang possible overpayment dahil may ghost o kaya upcased claims is 5.7 billion at hindi 3.6. And again, sumulat na naman po ako at last night po, twice na kasi akong nag-request ng data sa PhilHealth, no? The first time was when they submitted to me noong 13 July, and then last night po, no, at 10 o'clock, nagsubmit din sa akin. Makikita din natin may discrepancy na naman po for pneumonia claims for 2019. And ito, makita natin, no, yung 13 July submission, 830,000 ang claims for pneumonia. Kagabi naman, ang binigay sa akin na submission, 739,000 lang. So, ito yung sigurong concern na ni-raise kanina ni Congressman Marcoleta na paano naman natin lilinisin ang ating sistema kung napakasimpleng data lamang ay may discrepancies pa tayo. May comment ka ba dyan, Doc Ish?
Mr. Chair?
Yes.
Madam Congresswoman, the data was provided by the core plan na sila rin po yung nag-extract and gumagawa po ng stats and charts. May I refer po the core plan to respond to this data?
Yes, please. Go ahead.
Siguro, Mr. Chair.
Mr. Chair.
Before you continue, Honorable Kimbo?
Habang hinihintay natin si...
No, she's here. She's here. Okay, go ahead. The PhilHealth is recognized, the core plan.
Yes, Mr. Chair. Yung mga data po na ine-extract sa stats and charts, depende po sa script na ginagamit. Kung halimbawa po, based siya sa date of admissions, o kaya sa payment date, o kaya po sa receive or refile date. Minsan po, depende rin ho yan kung kailan in-extract. Kasi everyday ho, gumagalaw ho ang database. Dahil may pumapasok po na claims at meron pong nababayaran na claims.
Pero ito po ay, Mr. Chair, is reported for the whole year. Maintindihan ko po yan kung yan ay interim report. Pero 2018 was a year and a half ago. So dapat, by now, dapat malinis na po ang mga datos na yon. So, anyway po, nire-raise ko talaga to dahil napaka-importante po nito. As you can see, ang discrepancy po na about 100,000 already means something like an additional 2 billion pesos na maaaring nawawala po sa fraudulent claims. So, Mr. Chair, siguro, hingan na lang po natin siguro ng report ang PhilHealth tungkol dito. Baka they need to really look into this and explain to us ito pong discrepancy.
Yes, we will do that. The corporate group of PhilHealth will be checking on it, Honorable Kimbo. Honorable Kingo, can we go to your last question?
Yes, just give me like 3 minutes. I have 2 more slides. Ito po, tinignan ko po ang regional claims, no? And as you can see here, dinivide ko po yung number of claims sa bawat region by the population. And as you can see, sa bawat region, ang laki po ng pagkakaiba. Halimbawa po sa NCR, merong 45 pneumonia claims per 10,000 population. Pagdating sa Mindanao naman, o pagdating sa Bicol, it's just 37. Pero pagdating po halimbawa sa Northern Mindanao, mataas, 140. O kaya sa Soc-Sargen, 149. So ang tanong ko dito is there any reason, Doc Ish, ikaw ay isang doktor, is there any reason for us to accept na dapat merong malaking pagkakaiba ng pneumonia incidence across regions? Kasi po, ang pagkakaalam ko, ano ba ang risk factors, Doc Ish, ng pneumonia?
Well, Mr. Chair, one, since it's the pneumonia is an infectious disease, so technically po, ako sa paningin ko po, ay maaari pong dapat halos ay pare-pareho, or kung meron man pong variation sa regional data, ay maaari po na konti lamang. However, pwede rin naman pong magkaroon ng mas malaking variation sa isang lugar, especially po kung dito halimbawa ay mas dikit-dikit ang mga tao, mas madali po silang magkakaroon ng pagkakahawahan. Maaari din po kung may epekto halimbawa ang vaccination, ay sa isang lugar na mas mababa ang vaccination, ay maaari din pong mas mataas ang pagkakaroon. Ganon din po yung tinatawag na sa halimbawa po sa economic situation, maaaring para doon po sa mga lugar na hindi mababa ang resistensya ng mga tao dahil hindi nutritious sa mga kinakain, maaaring mas magkakaroon ng mas mataas na pagkakataon na magkakaroon sila ng hawahan or pagkahawa sa pagdating dito sa mga infectious diseases katulad po ng pulmonya.
Pero kayo na rin po mismo, Doc, is yung nagsasabi na there should be no reason for us to expect na napakalaki dapat ng regional variation. So ang aking pong, kaya ko to pinapakita sa inyo, I didn't have time kasi nga last night po, 10:41 po ng gabi nyo binigay sa akin ng data na hiningi ko. Hindi ko na po natapos ang the rest dito. Is this something that you can fill up for me? Ang point ko lang dito is if we are expecting a fraud of a magnitude of about 3.6 billion pesos, ang tanong is, ano yung distribution ng 3.6 billion na yan sa mga regions? Diba? Kung ang iniisip nga po natin ay, yan po ay depende sa galing ng isang regional vice president, dito po natin makikita kung saan ba talaga, sino ang magaling sa fraud control among our regional vice presidents. And ito na lang pong last na gusto kong ipakita sa inyo, no? Ano kaya nangyari nung 2015, Doc Ish? 2014 claims for pneumonia, 573,000. Pagdating ng 2015, naging 791,000. No, ang laki naman po ng talon ng pneumonia. So ito ay, we're talking about the whole country, di ba? So lahat ng nabanggit niyo kanina na risk factors, yan po ay pwedeng magpaliwanag ng pagkakaiba-iba across regions. Pero ito po, ano kaya naging dahilan kung bakit biglang lumobo ng ganyan kalaki from 2014 to 2015? And makikita po natin ang regions na to, regions 12, 11, and 10, ang siyang may pinakamalaking jump or spike dito po sa pneumonia cases.
Mr. Chair, Madam Congresswoman, I will have to check on that po.
Pero ang point ko lang,
Honorable Kimbo?
yes, I will wrap up, Mr. Chair. Ang dahilan po kung bakit ko pinapakita po sa inyo, it took me about 3 hours to look at your data. Kinailangan ko lang ng ballpen, paper, at Excel file. Ito po ay nagkaroon po ako ng rapid assessment po on possible fraud. So ang sinasabi ninyo na hindi nyo makontrol ang fraud dahil wala po kayong IT system, ay sa akin palagay po, ay it's not a valid excuse. No, you only need very simple indicators to find out na merong fraud na nangyayari. So, sana po I support you in trying to migrate to a better IT system because that's going to help you with fraud control. I support you on that. But it should not be an excuse na hindi niyo makakontrol ang ganito kalawak o ganito katalamak na fraud nang dahil wala kayo nun. And you also don't need a world-class IT consultant or health insurance consultant for you to find out. Ang importante po na meron kayong mga dashboards na, iba yung dashboard na in-introduce po ni Dr. Banson nung panahon po niya. I think you should use something like this for purposes of detecting fraud. So yun lang po, Doc Ish, ang aking
Yung mga nagtanong, kanina pa po ako nakapila, mukhang hindi po na-observe no, yung minority-majority rule at yung oras po nung ilang minuto o ilang segundo, pwedeng magtanong yung iba. So if I may, Mr. Chair, may I be allowed to proceed to my line of questioning?
Yes, the Honorable Garin.
Tawagan kita, Kinga. Very prominent, Mr. Chair, sa mga narinig kong mga kasama natin kanina. Ang katanungan po ng lahat is, how do we clean PhilHealth? Pwede ko po bang marinig sa ating mga official ngayon kung sino po ang makakasagot dun sa tanong na how do we clean PhilHealth? Yeah, Mr. Chair, if may we request Dr. Pargas, Dr. Ish, to answer the question of how do we clean PhilHealth?
Mr. Chair, Madam Congresswoman, well, for one po, gaya po ng palaging nababanggit ng ating President and CEO, we need a robust information technology system because currently, right now, our IT systems as identified is not integrated, it is fragmented, and so we need our system so that our checks on this ay mas madali po dahil ito ay magiging kabit-kabit. May mga ganun pong pagkakataon na kinakailangan
Mr. Chair,
natin.
with due courtesy, if I may be allowed to interject, Ish, can you please give direct answers? Huwag na po yung paikot-ikot kasi sayang po yung oras. So, how do you intend to clean PhilHealth? First, you said you need a robust IT. Next.
We need to have policy changes po.
What specific policy changes, Mr. Chair?
Well, for one po, katulad nito, nakikita po natin yung sa provider payment mechanism na nagkakaroon po tayo ng mga issues. So we have to go and check what is the most appropriate provider payment mechanism that we can have. We also need to have a review on our business processes so that we can have a definite reorganization and organizational structural change para mo mas maging adaptable siya dun sa pangangailangan ng ating mga ngayon, especially going towards UHC, and of course, in making sure that we have people who are really capable on providing the services. Third is, of course, cleansing the organization because as it is, right now there are alleged corruption and there are alleged wrongdoings, I suppose, happening as alleged again. And
So, Mr. Chair, distinguished resource person, by your statement alone, you are admitting that there are a lot of wrongdoings and corruption in PhilHealth.
Mr. Chair, again, as I've said, those are alleged and
No, Mr. Chair, the answer was very direct. How do we clean PhilHealth? And Dr. Ish Vargas gave 4 answers. IT, policy changes, specifically on provider payment mechanism, review of business processes, and putting changes in the organization because of corruption, alleged corruption. If you are proposing, Mr. Chair, to clean PhilHealth by that way, therefore you're admitting that there has been corruption or there is corruption in PhilHealth.
Mr. Chair, Madam Congresswoman, again, as I've said, there are alleged corruption, and so we have to really look into that.
No, Mr. Chair, my point is this. Ang katanungan po, paano lilinisin ang PhilHealth? Ang sabi nyo, magkaroon ng reorganization para mawala ang korupsyon at fraud sa PhilHealth. Are you saying that you were just speaking and giving us flowery words to joderize the current status of PhilHealth?
Congresswoman Garin, kanina nga po, inabi na nga ni Dr. Vargas, may 3 bilyon ang nawala. And if we go back to 2018, may nawawalang pondo, period. As to sinong nagiging corrupt, hindi pa natin alam. Pero as to the allegation of corruption, meron. Honorable Garin, please continue.
Yeah, may we ask that direct question to Dr. Vargas? May nawawala po ba o hindi? Or wala?
If it is due to, Madam
Mr. Chair,
Mr. Chair,
can we request Dr. Pargas to answer with a yes or no? Kasi ang napapansin ko lang po, hindi lang po ngayon. Sa ilang mga nakaraang hearings ng PhilHealth, masyado pong magaling si Ish sa paikot-ikot na mga sagot. And sometimes these indirect answers are actually geared towards diffusing the facts or misleading the investigators. So please answer the question. Is there corruption in PhilHealth or none?
Mr. Chair, Madam Congresswoman, I cannot confirm po.
Ano po?
I cannot confirm po.
So nagbabago ngayon?
Ito, may kino-confirm kami nawawalang pera.
Opo.
Okay, so may nawawalang pera, hindi pa natin alam kung sino ang may gawa.
Mr. Chair, at hindi ko rin po alam kung ito ay dahil sa korupsyon. Pero
So may nawawalang pera, baka nahulog sa bintana, hindi po siya napunta sa korupsyon. Or baka nawala siya kasi merong ibang nagbit-bit. Ganun po ba?
Kaya nga po sa ngayon, nagkakaroon ng mga tinatawag na ganitong investigasyon, kaya rin po may mga nakafile na kaso sa aming legal para po patunayan kung talaga po merong mga nawawala na nanggaling sa korupsyon.
Susundan ko yung question ni Kong Garin, may nawawalang pera, umamin ka na, no? Sabi mo, may nawawalang pera. Hindi natin alam kung kagagawan ng mga taga-PhilHealth o kagagawan ng ospital.
Opo, Mr. Chair.
Thank you.
Okay.
Congresswoman Garin.
Mr. Chair, next question. Ilang taon ka na po ish sa PhilHealth? How many years have you been with PhilHealth?
Mr. Chair, Madam Congresswoman, ako po ay napunta sa PhilHealth noong 1999.
How many years have you been in
So that's
PhilHealth?
roughly-
Direct answer please. 1, 2, 5, 10.
Less than 21 years po.
How many years?
Less than 21 years po.
20 or 21 years?
Years po.
21
This
years.
August.
Yeah. May I request, Mr. Chair, distinguished resource person, please don't waste the time of this committee. Please give us direct answers. Huwag na po tayo dun sa palaging palusot na paikot-ikot. Mawalang galang na po. No? So you have been in PhilHealth with 21 years. And earlier you mentioned that you are proposing changes in PhilHealth. Sa pananaw niyo po, in the 21 years that you have been with PhilHealth, why is it that you have not contributed to reforms in your institution?
Please answer directly, Mr. Vargas.
Mr. Chair, in my own ways po, tayo po ay nakatulong sa korporasyon. Unang-una, ako po ay nagsimula bilang medical evaluator sa region, sa claims processing. Pangalawa po, nung po tayo ay nagkaroon ng pagkakataong maging manager ng benefits development, tayo po ay nakapagpalabas ng mga polisiya, lalo kasama na po dito yung no balance billing, and initially we started with the 23 case rates. After that po, no ako po ay nasa communications.
Teka, papasensya na po ha, let me interject. Mr. Chair, ulitin ko lang po. Malaki po ang naitulong niyo sa PhilHealth because number 1, you proposed the no balance billing. Number 2, you proposed the initial 23 case rates. Tama po ba ang naririnig ko?
Kasama po kami dahil kami po yung nasa benefits during that time, noon pong nagkaroon tayo ng initial 23
Mr.
cases.
Chair, with
no
that,
balance.
may we request the Secretariat to request an itemized list of actions done by Dr. Ish Pargas on how he has contributed to cleansing the institution that has been connected for the past 21 years. Let me move forward.
The committee secretary is directed to get all the documents pertaining to what Congressman Janet Garen is asking, pertaining to all the contribution of Mr. Fargas, and thereby, accordingly, all these documents have been approved by the PhilHealth Board as well. So ordered.
Thank you, Mr.
Go ahead.
Chair. Ayoko na po sanang magtanong, but then because I was here the whole day and prior to coming here, I was on Zoom listening to answers, to some of the answers. Medyo nakaka-insulto po kasi, lalo na kapag may mga naririnig tayong mga jodorizer or mga kasinungalingan. Unang-una po, let me point earlier the statement of our chair. Our Honorable Chair mentioned that in 2014, bigla pong tumaas yung pneumonia, acute gastroenteritis, and there were a lot of other illnesses. The slides are actually in my office because I was listening from there. Mr. Chair, just for purposes of transparency, I became a chairman of the Board of PhilHealth for 1 year and 4 months approximately. At ang una ko pong nakita na medyo nakakapagtaka, ito nga pong tinuro ng ating butihing chairman, Congressman Mike Defensor. And the Congress and Senate has passed a lot of good laws. Simulan ko lang po yung pinakamalaking reason why there are a lot of fraudulent claims related to pneumonia, gastritis, hypertension, name it, you have it. Pwede ko po bang tanungin, Mr. Chair, ang ating butihing resource person, kailan po ba ipinasa ang Senior Citizens Law?
Madam Congresswoman, the effectivity date of RA number 10645 or the Senior Citizens Law expansion is, I will have to check on this, is November 2014.
So the Senior Citizens Law was passed on November 2014. Mr. Chair, napaka-importante po ng petsa na ito. Because this will display how laws with good intentions are actually abused by people who should have taken care of the members of PhilHealth's money. November 2014, ipinasa ang Senior Citizens Law. Nakasaad po doon yung membership ng ating mga senior citizens para po sila maging miyembro ng PhilHealth, lalo na po yung mga walang trabaho. My next question, Mr. Chair, is this. Dr. Pargas, kailan po ito napirmahan ng Presidente ng Pilipinas? November 2014 was the approval in Congress or in Senate?
Madam Chair, Mr. Chair, Madam Congress, ko po alam kung ano yung exact dates.
So November 2014 is what? The approval in Congress or Senate or the approval of the Office of the President?
Effectivity date po of RA number 10645.
Meaning, effectivity date, this is the day that that proposed measure was signed into law. This was approved by Congress either September or October, somewhere during that time. At dahil pinirmahan nga ng Pangulo, nakasaad po doon na bibigyan ng pondo para ma-enroll yung ating mga senior citizens. Kailan nyo po in-enroll sa PhilHealth yung ating mga senior citizens na hindi pa miyembro ng PhilHealth?
I would think sometime in 2015, Dr. Vargas. 2015. I'm sorry. If it's November, yung
2016,
yes,
Mr. Chairman.
Yes.
Yeah. Para lang po
I
sa
stand corrected.
kaalaman ng lahat, no? Pagka tayo'y nagpapasa ng isang batas, dumadaan po siya sa Pangulo ng Republika ng Pilipinas, pinipirmahan, and after that law, it is funded. Because the law was passed in November, a point at which the budget for the next year, and 2015, has already been made and approved, isinasama na siya dun sa pondo ng 2016. Mr. Chair, tama po ba ako?
Yes, Madam Honorable Garin. You're correct.
Kasi, dun po sa presentation mo kanina, isa lang po ang sagot doon. When Congress passed the law in October of 2014, right there and then, the next day, Dr. Ish Pargas immediately went on a press conference and informed all senior citizens to avail of many services. At yan po ang naging puno at simula ng paghahakot ng ating mga lolo at lola na akala nila para sa kanilang kapakanan. And I was surprised because during this time, I was somewhere in Mindanao and I saw a truck full of passengers. Una, akala ko mamimiesta. Pangalawa, akala ko may namatay. Sabi ko, mahirap naman dun, no? Ang daming senior. It was only after a few weeks and a few months that I realized na ito pala inahakot sa iba't ibang mga clinic, and the senior citizens law became an excuse for PhilHealth and their cohorts to rob the people's money. Can Dr. Ish Pargas affirm to that?
Dr. Vargas?
Madam Chair, Mr. Chair, Madam Congresswoman, there was a board resolution in 2014 that the entitlement to the identified programs for senior citizens shall commence on November 25, 2014, which is the effectivity date of RA 10645. It was a board resolution 1922, series of 2014, and after that po, a circular was issued also in 2014 as the implementing guidelines for the mandatory PhilHealth coverage of senior citizens.
Okay, Mr.
Again,
Chair,
pursuant to that.
ang sinasagot po ng ating resource person, ang sinasabi niyo po, dahil noong 2014, nagkaroon ng board resolution na i-implement na yung panukalang batas na ito. When did you come out in a press conference and announce to the whole country and inform all the hospitals and the regional vice presidents to let the senior citizens avail of a check-up that brings them to the hospital where they are given free food, but their PhilHealth availments are actually depleted.
Mr. Chair, Madam Congresswoman, I don't remember na po. I apologize.
Pwede mo po bang ma-search? May wifi naman po dito. Di ba may date po doon kung kailan nyo in-announce yun? And this was the subject of several meetings we had, Ish. And I even asked you several times, why did you have to announce in public? Lahat ng senior citizens, magpa-konsulta kayo, magpa-check up kayo, magpa-admit kayo, kasi libre na babayaran ang ospital nyo. And I asked you, why do you have to do that? You did it a day after Congress approved the bill on third reading, even before the President signed the law. So, Mr. Chair, let me move forward. Kasi hindi po mahirap hanapin yung date ng press ko na yon kapag ikaw yung nag-announce. Ibig sabihin, ginagawa pa lang yung batas, nakaantabay na yung mga magnanakaw. Dahil in-announce na kaagad at ready na yung lahat na pagkapirma ng batas, naghakot na ng mga lolo at lola. Despite the fact, Mr. Chair, that DBM did not release the funds for the enrollment. I am not saying that we don't give them free services. We should. But what is glaring here, wala pang ang batas, wala pang IRR, hindi pa napopondohan ng DBM, in-implement nyo na. And PhilHealth recorded that as collectibles. Kaya nga po, ni-record nyo na may collectible kayo ng Senior Citizens Premium ng 2014, Senior Citizens Premium ng 2015, and noong 2016, kinokolekta nyo times 3 the actual premium. That is the reason, Mr. Chair, kung pwede pong makuha ng komitiba yung mga datos at mga dokumento that will support what we found out, because that will explain the graphs that you presented earlier. Let me move forward. Ang masakit po kasi, ilang announcement na ang narinig natin na yung frontliners o yung mga doktor, yung mga laboratory personnel, yung mga nag-handle ng hospitals at mga pasyente nating may COVID ay libre ang kanilang COVID tests. Do you affirm this?
Mr. Chair, Madam Congresswoman, ang polisiya po natin pagdating sa COVID testing ay kung sino po yung nasusulat sa DOH Department Memorandum for the testing, sila po yung nakaka-avail.
Yes, Mr. Chair, the frontliners, the healthcare workers na nag-aalaga sa ating mga pasyente ay nasa DOH protocol po. At kaya nga po ang presumption ng lahat ay covered sila. Unfortunately, the laboratories that are testing them are now asking them to pay dahil hindi raw sila binabayaran ng PhilHealth. Kasi ang sagot daw po ng PhilHealth, in-announce yan, pero wala pa yung guidelines. Do you already have the guidelines? Whether frontliners, direct frontliners, and I mean medical workers, hospital workers, doctors, medtechs, nurses, people inside the hospital catering to our patients are already covered by PhilHealth.
Mr. Chair, Madam Congresswoman, again, with our circular po doon sa testing, naka-attach po doon ang guidelines ng DOH kung sino po yung covered. So effectively po, kasama po doon ang ating mga frontline health workers, Mr. Chair.
So doon po sa inyong guidelines, ang sinasabi po, kapag ikaw frontliner, bayad na ang testing mo.
Again, kasama po yun doon sa guidelines. Kung sila po ay...
What guidelines, Mr. Chair? Is it PhilHealth guidelines or DOH guidelines?
Doon po sa kung sino po ang i-cover for the testing, yun po ay nasa DOH guidelines. Doon naman po sa testing circular guidelines namin, doon po nakasulat yung package kung magkano, and again, nakalagay din po doon na dapat ito po ay copay.
Ano nakalagay doon na?
No copay po.
Okay. Mr. Chair, medyo may gray area po. Ish, can you answer us directly? If DOH issues a guideline or merong memorandum ang Department of Health, Mr. Chair, yan po ba ay automatic na memorandum na rin ng PhilHealth or hindi? Yes or no, please?
Yes, Mr. Chair.
Do you mean to say that if the Secretary of Health or an Undersecretary issues a memorandum, it's an automatic memorandum of PhilHealth?
Mr. Chair, Madam Congresswoman, as I understand po, PhilHealth being an attached agency, and of course the chairperson is the Department of Health, then we will follow the...
No, Mr. Chair, my question is direct. Please give me a direct answer.
Mr. Chair, as I understand, yes.
So pag merong memorandum ang DOH, automatic memorandum na ng PhilHealth yun?
No, Mr. Chair,
You don't issue a board resolution or guidelines for that matter? Because I can present to you all the requirements like Yolanda. Nung nagkaroon ng announcement ang Secretary of Health that all the patients will be covered, PhilHealth convened the board and the board issued a resolution to support
yes.
the Secretary.
Mr. Chair, Madam Congresswoman, I clarify, yes po, all our policies would have to go through the board resolution or through the board being the governing policy in order to adapt any policies of the government po.
Because PhilHealth is a GOCC. It is not directly under the Department of Health. Right? That's why the Secretary of Health sits as the chair of the board and many other people sits in the board representing other government agencies. So ulitin po natin and please confirm this. Kapag meron pong direktiba ang Department of Health, hindi po yun automatic sa PhilHealth. The board convenes, issues a memorandum, and you come up with guidelines for the implementation. Tama o mali?
Mr. Chair, tama po. That's why with the circular guidelines po natin,
Kaya po,
siya.
tama po. So Mr. Chair, ang sinasabi at inuulit po ng ating PhilHealth officials ngayon, kapag merong memorandum ang Department of Health, kailangan ang PhilHealth mag-convene and they decide whether they accept it or not. After accepting it, they come up with guidelines so that it will be implemented. Klaro po tayo doon. Can I again get your confirmation on this?
Mr. Chair, Madam Congresswoman, as far as I know, yes.
Thank you, Mr. Chair. Kasi ang nakakapagtaka po, sinasabi niyong covered kasi nasa DOH algorithm, pero wala kayong ginawang guidelines. Kaya tuloy ngayon, gray area, sinasabi niyong covered, pero yung ating mga frontliners, yung mga doctors, nurses, nagkakamatayan na nga sila. And their testing is not covered. Sila pa ang nagbabayad. Pinapabayad sila dahil yung mga laboratories hindi na nire-refund nyo dahil walang guidelines. Pero sa senior citizens law, mabilis pa sa kidlat na inimplementa nyo ito maski wala pang guidelines or wala pang IRR ang batas at wala pang pondo na binibigay sa inyo for enrollment. Nakikita nyo po ba ang diferensya?
Yes, Mr. Chair. Madam Congresswoman, again po, just to say lang po, there was already a board resolution in November.
Can you give me a copy of the board resolution?
Yes po. We will provide po the
This is a board resolution on the frontliners for COVID testing?
No. This is on the senior citizen. But for the testing po, we will provide also the board resolution.
Meron na ba talagang guidelines ang PhilHealth stating for a fact that testing of frontliners is covered or not. Because I will now move to the next question, whether it's tenable or untenable. Because you check the frontliners every 3 weeks. So you have to have a special fund for that. Anyway, Mr. Chair, just so as not to waste time, ang ibig po ditong sabihin, may batas na ginawa para sa ating mga senior citizens para bigyan sila ng benepisyo, hindi pa man napipirmahan yung batas, wala pa mang IRR, wala pang pondo, hindi pa in-enroll, hinakot na. Ginawan ng sakit na lahat may high blood, lahat may pneumonia, lahat may acute gastroenteritis, yung iba may diarrhea, at inubos ang pondo ng PhilHealth. This explains, Mr. Chair, the second problem, yung admin cost. Kasi po, para po malaki ang magastos nila dun sa mga biyahe, mga meeting, at kung mga ano-anong activities, blino-bloat yung income ng PhilHealth. So the law, like the senior citizens law, was actually used to claim retroactive premiums. Is that allowed in the context of our laws, Mr. Chair? May I ask anybody here who's handling the finance or the admin side of PhilHealth?
Anyone can reply to the Honorable Garin? So retroactive premiums.
Ang nangyari po, pinag-uusapan pa lang sa Kongreso yung senior citizens law na you don't have to be an indigent, automatic member ka na. Nag-announce na sila, in-implement na nila. Kaya hinakot yung mga lolo at lola, chinek up kunyari, pagkatapos sangkatutak at bilyones ang siningil sa PhilHealth. When we found out about this triggered us to initiate classification of pneumonia. At ang nangyari po, dahil 2016 pa yung pondo na na-enroll sila, ginawa nilang retroactive. Kaya ang sinasabi nila, may collectible sila, maski wala naman. This
Honorable Green, so 2016 yung pondo lumabas, pero inobligate nila sa 2014.
Lumabas yung 2014, hinahakot na. Basta mag-senior ka, mag-avail ka na. At ang ginawa naman, dun naman sa kanilang income, pinalabas nila na yung 2014 may binayad na premium. 2015, pinalabas din na collectible. Bakit? Kasi yung kanilang admin cost or yung gastusin sa mga biyahe at mga meeting is based on a certain percentage to the gross income. Siyempre, if you declare your income triple to what it is actually is, then you have a higher budget. Not only that, Mr. Chair, if we can also look at the issue of said premiums, there was also a time when they increased the premium of all the members.
Honorable Green, yeah. Since I understand Dr. Vargas understands this, tama po ba yung sinasabi ni Congresswoman Garin?
Mr. Chair, sorry, I will have to defer to the finance and to the...
But I would assume that she knows what she's saying because she was there and she knew what happened.
And she was the one who kept on announcing it and leading the program.
Is this correct, Dr. Vargas?
Again, Mr. Chair, I was the spokesperson then of the corporation.
No. I'm not referring to you directly. Ang tanong ko lang yung sinasabi ni Congresswoman Garin na merong mga nag-early enrollment tapos ginawa lang 2016 lumabas yung pondo, naging payable ng PhilHealth.
Po ako ang responsible for those billings and collection and on the finances po.
Mr. Chair, pwede ko bang, can I rephrase my question?
Sige po.
Yeah. In the meetings that you were present in PhilHealth and in all the official and unofficial discussions, Dr. Vargas, did you ever encounter a discussion wherein it was being questioned why you already implemented the program pero hindi pa sila enrolled? at hindi pa nababayaran yung premium nila.
Mr. Chair, Madam Congresswoman, I will have to recall po.
Mr. Chair,
Congresswoman Garin, may I know, sino po ba ang nag-head ng legal and finance at that time?
maybe we can ask PhilHealth, Mr. Chair.
But do you know who was the head at that time of the legal and finance? Because these are all connected. Isa lang po ba yan o dalawang tao?
Iba po ang sa finance during the time.
Who was the head of finance at that time, Dr. Vargas? Kung sino po may alam, wala naman po problema. Simple question.
Mr. Chair, Madam Congresswoman, I'm not sure po. Baka po si Mr. Greg Rolyoda. According to our finance.
Sino po?
Mr. Gregorio Rolyoda.
Mr. Gregorio
Rolyoda.
Rolyola. Sige, Comsec, can we invite the person at that time, 2014 po to, not 2015. Who was the head of legal at that time? Congressman, maybe, baka po hindi
They would know the people there, Mr. Chair. They were going to the same office every day.
So who's the head of legal at that time?
Nakakapagtaka naman po na hindi marami kayong hindi ma-recall. I didn't know, Mr. Chair, that temporary amnesia is now a trend.
Yes, Dr. Pargas.
Mr. Chair, I am not sure for 2014-2015 if it is Attorney Jermaine Lim. Asuncion. Mr. Chair, Attorney Asuncion, Ed Asuncion.
Attorney Asuncion. So, Comsec, kindly assist us in getting the name and if we can invite the persons mentioned. Mr. Relyoda is in Zoom right now. Gregorio Relyoda and Attorney Asuncion. Yan po yung dalawa.
Mr. Chair, Madam Congresswoman, I am not sure with the legal during that time. And confirm and we can check po.
Okay. When the President was President Alex Padilla, who was the head of legal?
Attorney Ed Asuncion.
Ed Asuncion. Okay. So, anyway, we'll just verify and we'll invite the person. Congresswoman Garin, kindly continue.
Mr. Chair, in addition to that, ito po kasing scheme ng senior citizens, yan po ang masakit na kunyari, concern sa senior citizens, pero ginamit sila to do fraudulent acts para po hakutin yung mga lolo at mga lola at maging rason para ilabas yung mga bilyon-bilyong pondo ng PhilHealth. There was also an instance where the collectibles that they are referring to, nagtaas ng premium ang PhilHealth and they also retroactively implemented it. Ibig sabihin, nagtaas sila ng premium, in-implement kaagad ng private sector, pero dahil yung mga government offices that would entail a budget from the DBM, meron pong finance cover yan, it was implemented after, I think, a year or two. Again, ginawa nila yon na collectibles. Para po ang nagiging attitude, pag merong board resolution, agad-agad dapat nandiyan na yung pera, even if there is no corresponding appropriation. Kapareho po ng scheme ng senior citizens. Again, this was added as part of the collectibles. Maybe if Greg Rolyoda, the finance head, is on Zoom, he can answer that.
Mr. Relyoda is recognized.
Yes, ma'am. Good evening. Right now, I am now the current regional vice president of NCR. The senior citizens on is that because of the board resolution with regards that the program is now to be implemented. So that's the reason, because of the enrollment of these senior citizens, what is really the listed list of senior citizen is the one that was recorded as a receivable in the DBM because of the implementing rules and regulation of that. So that was recorded, and
Mr.
we
Chair?
got a unqualified opinion for those years when we book it up as receivables.
Yeah, Mr. Chair, i-clarify nga natin kay...
Yes, go ahead.
Correct. Yeah, he mentioned that because there was a board resolution, they have to immediately implement the law. Tama po ba?
Yun po yung naging basis namin, ma'am, for the...
No, yes or no? Because there was a board resolution, you have to immediately implement the law. Yung ba? Ang ibig niyong sabihin?
Yeah, that's the basis of our recording, ma'am.
Okay. So pagka merong board resolution, maski hindi pa pirmado ang batas, or maski wala pang IRR, you have to implement it. Question is this: how can you implement a law if there is no accompanying IRR yet?
The legal department can, I cannot answer for that, ma'am, but I think our legal later on can answer for that.
Okay. Greg, you were the finance head. Pagka sinabing i-implement nyo ito, titingnan mo ba kung bayad na yung premium or hindi pa? To laymanize it, whenever you consider a certain person or a certain family as member of an insurance company, can he or she be a member without payment of his or her premium?
Ma'am, because this is a mandated...
Greg, yes or no? You're a finance person. Ikaw ang finance head. Let's say, sasabihin ni Congressman Mike Defensor, i-enroll nyo si Janet. Bibigay nyo sa kanya ang lahat ng benepisyo ng PhilHealth. Pero, ayaw pang bayaran ng Kongreso ang premium ko. Am I already a member or not yet?
Based on the board resolution that the effectivity of the senior citizens law, they are automatic members based on that.
Mr.
legal
Chair,
basis
can
as,
we request Mr. Greg Rolyoda to just come to Congress on the next hearing? Mahirap po kasi yung pinapaikot-ikot yung mga sagot eh. Napakasimple po ng tanong, kaya pong sagutin yun ng high school student. Kapag ikaw ba gagawing miyembro ng insurance, kung hindi ka pa nagbabayad ng premium mo, miyembro ka na ba o hindi pa?
The mere fact that there's an automatic membership of the senior citizen based on that board resolution, it is presumed that they are members. But I am willing to be there in the next hearing so that
Mr.
I can also
Chair,
prepare.
I move that we request the presence of Mr. Greg Ulloda in the next hearing. And for the record, let us put it on record and check who are the people who are continuously twisting interpretations, legal interpretations. Kasi sa buong mundo, Mr. Chairman, ngayon lang po ako nakarinig ng insurance na maski hindi ka pa nagbayad ng premium, member ka na. Meaning, if we now deliberate on a law, because the board is a governing body, but supposed to be the day-to-day operations, including membership, will have to be provided by the career people inside the institution. Mr. Chair, if this is the way PhilHealth is operating, surely it's very obvious that they cannot continue existing. Kasi kung ang utak mo, miyembro ka na, maski hindi ka nagbabayad ng premium, edi ibig sabihin, talagang magko-collapse yan. So I would have further questions on that, Mr. Chair. Kay Mr. Greg Ulloda na lang, what was that instance where you also had a lot of collectibles pointing to the fact na nag-board resolution kayo, in-increase yung premium, pero wala pang pondo yung gobyerno, but you already considered it as added income, actual income. Can you also provide the documents for that?
We will provide the documents for that.
Honorable Garin, so Mr. Ulloda, so in the next hearing on Monday, we will resume on Monday 9 a.m. we expect you to be here in the plenary committee hearing, Mr. Yodat.
Yeah, and that, Mr. Chair, is very important because that will also explain why there was a lot of wastage. Next, Mr. Chair, no, earlier again, Dr. Ish mentioned, paulit-ulit niya po kasing sinasabi yung USAID. I am wondering, Mr. Chair, because USAID is a very prestigious organization. USAID na po ba pala ang gumagawa ng packages for PhilHealth?
Mr. Chair, Madam Congresswoman, hindi naman po, but we sought their help, especially with regard to the costing, and we were provided with help by the Palladium of the USAID.
Yeah, Mr. Chair, may I request that we request PhilHealth and you to provide us a document wherein USAID is contributing or funding or estimating or crafting cost of tests?
Mr. Chair, Madam Congresswoman, they are not funding po, but they provided the technical assistance.
Technical
So,
assistance.
meron itong there are documentary attachments regarding this.
Yes, Mr. Chair, and in fact, even during our board presentation, with regard to the presentation on the costing and the cost elements, it was the Palladium which actually presented.
It was
The Palladium po, which is under the USAID.
So, sorry, Mr. Chair, hindi ko maintindihan. Okay. So can we have documents on that? Because I'm not sure if that is within the gambit of the USAID. Kasi mahirap po yung ganun na it's very difficult for us to just follow hook, line, and sinker recommendations of groups who do not have the expertise in so far as health financing is concerned. I am not aware of experts on health financing that USAID is providing in terms of viability of public health insurances.
Honorable Garin, just a quick interjection before you continue. I am in receipt of a letter signed by Attorney Macabato, Romeo Alberto, Datu Alonto, Johnny Chua, and Dennis Adre, sometime in mid-2000, that they already wrote a letter. These are the Mindanao group about the all-case rate. And they were already asking na tanggalin na to kasi nag-worry sila na mauubos ang pondo ng ating PhilHealth. If they are here right now, kung nasa Zoom po sila, kung pwede ho makakuha ng official submission yon ng letter na to, and if there is a record in PhilHealth Central, if we may be provided with that. So, I'm sorry, Honorable Garin, please continue.
Yeah, that's very good, Mr. Chair, because I personally, together with the staff that I brought in to PhilHealth, initiated the review of the case rates. Kagaya po ng pneumonia, it was just blanket pneumonia. At ang una po namin tinanong doon, paano isang araw pneumonia ka na? Because there were a lot of admissions na isang araw lang. Yun nga senior citizens law, kunyari, hinahakot yung mga lolo at lola, ina-admit ng isang araw, lalagyan ng pneumonia, swak na kaagad. And this was very glaring. Kasi truck jeep alam ng lahat ng mga barangay. And they were actually seekers. So, reviews were conducted. In fact, we required a minimum of at least 2 to 3 days. Was it 3 days admission?
Yes, Mr. Chair. 72 days, 96 days.
72 days admission.
72 hours, 96 hours.
Kasi ang naging trend po, makikita mo, magpapa-admit ng Saturday, lalabas ng Sunday. Parang nag-one night na relax ka lang. Pero yun naman, relax din yung PhilHealth na uubos ang pondo. And it's very, scientifically speaking, it's impossible that you end up with pneumonia and you just get admitted for a day. So we requested X-ray results and all that. My question is this, Mr. Chair, why is it that the review of case rates stopped when I left PhilHealth? Bakit bakit nyo hininto?
Mr. Chair, Madam Congresswoman, again, I was in corporate affairs until early 2018. So, I mean, during that time, Mr. Chair, Madam Congresswoman, I was not part of the
Okay.
sector.
Direct question again, Mr. Chair. Hininto ba yung review ng case rates or hindi? Was it stopped or was it continued?
Mr. Chair, I think it was continued because, again, as stated by Madam Congresswoman, for example, in the pneumonia, there was a requirement of the length of stay together with other diseases.
No, Mr. Chair, pasensya na po. I think he did not get my question. My statement earlier said that I initiated review of case rates. When I left, it suddenly stopped. So yung tanong ko, bakit hininto o bakit pinahinto?
Again, Mr. Chair.
Not the case rates that were already adjusted. These were already implemented. Pero una lang yun eh. We only reviewed dialysis and pneumonia. There was supposed to be cesarean, AGE, pasunod-sunod na yun eh. Bakit huminto? Who made it stop?
Again, Mr. Chair, I came back to the health finance policy sector only in mid-2018, so I cannot answer for this stopping or the question.
Okay, the answer, Mr. Chair, is he refused to answer dahil hindi siya kasama doon sa opisina. Next question. Another strategy that we embarked on to curb fraud was the stop payment mechanism. Because if you review the history in PhilHealth, ang daming fraudulent claims, wala kang laban kasi ang isasagot sa'yo palagi, hintayin na lang na matapos sa Supreme Court. And that will take several years. And while the case is taking its toll in the courts up to the Supreme Court, patuloy naman ang fraudulent activities. And our assessment during that time, if you have, let's say, Hospital A, maraming fraudulent claims, hindi mo aaksyonan, sasabihin mo, hintayin ang Supreme Court. In the 7 years or 10 years that you are fighting for that case in the Supreme Court, millions and millions of funds are being suctioned into fraud again. So what did we do? We implemented the stop payment mechanism. Ibig sabihin, pag ikaw ay maraming kaso, at hindi mo yan pinaparesolve at pinapatagal mo at pinapadelay, go ahead, take your time. But you will not be able to get reimbursements from PhilHealth pending the resolution of your case. Mr. Chair, may I ask the people from PhilHealth if that was effective in curbing fraud?
Anyone can reply?
Bumababa yung fraud, specifically on cataract, dialysis, and pneumonia, when the stop payment mechanism was instituted? Do I take it that silence means yes? Let me move, Mr. Chair, to my next question. Who overturned the stop payment mechanism?
I'm sure someone knows who overturned the stop payment
Kasi ang
policy.
kagandahan kasi sana nun, Mr. Chair, dahil marami na nag-aabuso at right and left na, at dahil puso ng bawat doktor at ospital ang PhilHealth, the stop payment hurt them to the core. At marami ang lumapit at ang kanilang sinabi, okay, we're going to negotiate, we are going to stop fraudulent claims, we are going to align with the mandate of the Philippine Health Insurance, basta ipagpatuloy nyo na kami. And then nagkaroon ng mga settlement na kumbaga may fines, wala ng kaso, hindi na gagamitin yung mga abogado, para pahirapan yung PhilHealth. And that was good. So my question is, why would you overturn something that was helping your institution? And now you start talking about reforms, about cleansing PhilHealth, pretending that you can implement universal health care? My God, that's next to impossible. How can you implement universal health care if you insist and persist to be blind and deaf to what is happening around all of you? So, Mr. Chair, may I request that PhilHealth produce documents that overturned the reforms that I initiated with huge and extreme difficulty in PhilHealth. Napakahirap po, Mr. Chair. Wala po akong sinabi nung mga nakaraang panahon, but my experience as chairman of the board was very difficult. First, board resolutions were not being headed to. Minsan, hindi pa pinapasa, nagiging bulag-bulagan, at naiipit at pilit na winawala. It is not true na takot sila sa board resolutions, just like what they are saying and pointing to in the case of the senior citizens, because our experience actually points to the fact that many of our decisions, lalong-lalo na yung mga resolution related to fraud, being approved and passed by the board, ay hindi po pinapasa. Hahalungkatin mo pa yung bawat opisina, pupunta ka pa ba sa kababaan-babaang opisina at hahanapin mo only to find out na, oops, hindi pala inimplement. Ang isasagot sa'yo, ay, ma'am, hindi po nakarating sa opisina namin ang resolution nyo. That can be proven, Mr. Chair, if you look at the reckoning dates by which board resolutions and reforms on PhilHealth were passed, approved by the board, but remained unimplemented. So my next question, Mr. Chair, nung pong ino-audit na ang PhilHealth, right and left po na sinasabi, yung pera ng PhilHealth at yung pera daw ng senior citizens na 10.6 billion was diverted to DOH. Nagulat po ako because it's a big lie. May I inquire from PhilHealth if indeed there was entry of 10.6 billion to the coffers of PhilHealth? Can somebody from the finance department of PhilHealth or somebody from the legal office answer the question?
Mr. Lumisako, you can reply to that.
Mr. Chair, Your Honor, good evening. Based on record of PhilHealth, Your Honor, wala ho kaming natanggap na sinasabi ni Congressman Gary na 10.6 billion, Your Honor.
Mr. Chair, kung wala naman pala kayong natanggap, why is it that some of you here who are present here now kept on pointing to a 10.6 billion fund that was diverted from PhilHealth to DOH? Bakit pilit na gumagawa kayo ng mga kasinungalingan para pagtakpan ang mga pinaggagawa ng iilan?
Honorable Garin, would you know in particular who came out with a statement on that?
John Basa. I also saw Ish in many of the meetings in Senate and even here. And in fact, they had presentations to the board, explaining to the board na kaya walang pondo yung PhilHealth kasi dinivert daw sa DOH. Naniwala naman yung presidente during that time, si Dr. De La Serna, and their attention were diverted to issues that were actually non-existent. And that was
So,
why
Dr.
the real...
I'm sorry, Dr. Vargas was quoted as saying that the 10.6...
He was present in those meetings and during the times that the allegations, and I think he was the one who was always at the side of Dr. De La Serna.
But it was Dr. De La Serna talking about it.
Per the whole board was made to believe that it was inexistent, and during that time, I don't know, maybe like the people who were feeding the board wrong information ended up being promoted, Mr. Chair. Konsensya na po nila yun kung hindi nila aminin, kasi makikita nyo naman bakit yung iba dito ay nagkaroon ng mabilisan na promotion. And now some of them are senior vice presidents. Anyway, Mr. Chair, I just brought that out in the open because that is how strong the real mafia is. Kaya nilang gumawa ng kwento, kaya nilang magkunyari na may perang pumasok, kaya nilang magsabing may mga legal na basihan maski wala, at kaya nilang mag-implement ng batas maski hindi pa batas.
Honorable
Simply
Gary,
said,
quick interjection. Magkano ho yung pondo ninyo for media, for PR? We all have that. I was in housing, I had that. In the other agencies, I had that. Magkano ho ang pondo ng PhilHealth sa media? For PR. Mr. Dimsiaco?
Mr. Chair, Your Honor, sorry po, wala pa akong figure dito.
More or less. 300 million, 500 million, 1 billion?
Mas maliit ata.
Your Honor?
Mr. Chair.
Yes, who is talking? May I
This
recognize?
is Vice President Shirley Domingo.
Yes,
I'm handling the Corporate Affairs Group at the moment.
Yes, VP Domingo, go ahead.
Yes, sir. For this year, we have around 20 million for our budget for advertisements, prints. Around 20 million po for this year.
20 million.
Yes, sir.
Yun lang ho ang budget nyo for advertising?
Yes, sir, for this year.
For last year po, magkano po?
I think it will be around. That, but the year before that was around 70+ million. That would be around 2 years ago. But this was brought down for several reasons. Therefore, it will be around 22 million last year and this year.
Salamat po, Vice President.
I'm sorry, sir. I haven't the exact amount now, but it will be around that.
Opo, salamat po. Salamat po dun. Okay, Congressman Garin.
Mr. Chair, when Dr. Ish Pargas was the spokesperson, maybe he would know how much the budget was allocated for ads. Di ba, meron ka pong TV program? You had a TV program before, you had ads and campaign. Magkano po ba yun?
Mr. Chair, Madam Congresswoman, I don't remember po, but we can provide.
Yeah. Kindly check if it reached around 400 million.
Mr. Chair, Madam Congresswoman, we will provide po the details.
Okay.
400 million, Honorable Garin?
Maybe we can. He was the spokesperson. He was having
Yes.
his TV programs, and siguro naman yung intention is yeah, Mr. Chair, another question. Di ba kasi paulit-ulit natin naririnig walang pondo yung PhilHealth. At paulit-ulit rin kaming nananawagan. Why is it that PhilHealth is renting expensive offices in malls? Kasi matagal ko nang pinapakiusap na baka pwedeng tanggalin na lang yon para makasave tayo, yung pondo na yon, itulong na lang sa mga mahihirap. I will always say, hear a response, yes, yes, yes. Pero Mr. Chair, hanggang ngayon, tila nasa mall pa rin yung PhilHealth. The reason that was given to us before, mas maganda daw po pag nasa mall, baka po merong mga walk-in na magpa-enroll sa PhilHealth. Mr. Chair, distinguished colleagues, I would even appreciate it more if you have a clinic in the mall rather than an office in the malls. So is this still ongoing? Please answer. May mga opisina pa ba kayo sa mga rented buildings, sa mga malls? Kasi ang naging usapan natin, matagal na. In fact, I even volunteered and showed to you that it is possible by talking to the town of Gimbal, my hometown, and requesting the LGU to a portion, a space in the covered core sa munisipyo, isang opisina doon na pinaayos namin, pinagamit sa PhilHealth, free of charge. And we had several meetings and we told you, why don't you ask for a free space or a free office in each provincial capital or in each city hall para wala na kayong rental and you will be near to the services because many people would go to these government offices. I don't know, Mr. Chair, bakit gustong mag-opisina sa mall?
Honorable Green, can we go to the last question? Would there be a reply to Honorable Green, yung opisina sa malls? Go ahead, VP
Dennis Mas, sir.
Dennis Mas.
Nung assign ako sa PhilHealth Region 6, nag-open ho kami doon, ma'am, ng office doon sa town of Gimbal. So, na-establish yung office na yon. So, hanggang ngayon, ay parang service desk siya.
May bayad po ba yun or wala?
Alam ko, ma'am, operational pa yun hanggang ngayon.
Yes,
bayad
Sa likod ng, ano ba yun, parang gymnasium yun.
Yeah. Mr. Chair, my question to Dr. Dennis Mas, may rental ba yun or wala?
Nung araw, ma'am, parang rental ni Mayor, Christine. Yun yung pagkaalala ko.
Meron or wala?
Parang meron, ma'am.
Pagkakaalam ko kasi wala.
Sige. Check ko lang kasi medyo matagal na 2011 o 2012 pa.
So it is a replica, it is an example wherein you can actually hold offices under government offices at no cost to the members of the Philippine Health Insurance.
And some LGUs are volunteering para palapit yung services namin sa kanilang constituents. So nagpapalibre sila sa mga offices nila. Nandoon yung PhilHealth. Yung dinadala na lang natin yung computer sa tao. Kasi gusto rin nila yun, especially sa mga one-stop shop. Pero yung mga regional offices naman natin ngayon ay naghahanap rin ng malipatan na mas maganda, hindi binabaha, spacious, and then usually ground floor. And we are also updating our guidelines para maging responsive
Mr. Chair.
Convenient sa members.
Mr. Chair, if I may, kasi wala pa po ako sa PhilHealth dati, nasa probinsya pa lang po ako, paulit-ulit po kaming nagtatanong kasi yung po ang sagot kailangan ng spacious office, kailangan maraming tao, kaya dapat sa mall. Napakamahal po ng rental sa mall. Yung mga nagpapa-enroll naman, Mr. Chair, ng PhilHealth, wala naman sa mall Kung ako ay magkakasakit at kailangan kong magpa-reimburse or meron akong katanungan sa PhilHealth, hindi ako pupunta sa mall. I'll go to the hospital. So my question, Mr. Chair, is this. For the past several decades na pinag-uusapan natin, stop renting expensive offices. Stop renting malls and buildings. Nag-o-offer na nga ang mga governors. They have spaces in the provincial capitals. City mayors are giving you offices. You can share the office of the DOH regional offices. You can also hold office in the LG. Bakit kailangan magbayad sa mall? So my question is this, can you now commit under oath that all these offices will be terminated? Kasi sabi nyo, okay ma'am, next year.
Honorable Green, maybe what we should do is ask the board as a matter of policy na gawin po nila yan so that this will be followed by the executive officers. Yes, Mr. Mas.
Sir, some info, kahit dito man ako na-assign before sa NCR, ang Robinson talaga nag-offer ng free space sa PhilHealth. Ang tawag dito, Lingkod Pinoy. Libre ho yun lahat. Dito sa NCR, dyan sa Taguig, binigyan tayo ng SM. Dito sa SM, yung doon sa Aura, dito rin sa SM North. Mga libre ho yun. Pero totoo yun, may mga LGUs talaga na nag-offer doon sa...
So, Mr. Chair, libre lahat ng pwesto sa malls?
Ma'am.
Walang bayad kuryente, walang bayad
Except
tubig?
kung ganun kalaki talaga ng Region 6, napakalaki talaga ng regional office na yun eh. Pero kung mga ano lang...
Sir, sorry ha. Clarify ko lang. Yung Region 6, libre rin yun?
may bayad yun talaga ma'am kasi napakalaki
may bayad
talaga
yun.
yan. Napakalaki na talaga
So, minsan
yun eh.
may bayad, minsan walang bayad. Or pwedeng libre yung maliit na pwesto, pero may bayad yung malaking pwesto.
Yung maliliit ma'am, nasa malls, libre yun talaga. Pero kung regional offices talaga ng mga 2,000 square meters, mga 3,000, hindi na kaya, may bayad
Mr.
talaga
Chair,
yun. At saka dinadaan
just to
sa
clarify,
public
I'm
meeting.
not referring to promotional booths. Bumabalik po kasi tayo, sir eh. Ang nangyayari kasi, pagka may problema, either hindi natin tinatanggap na may problema or naghahanap tayo ng palusot. Kasi sinasabi nyo ngayon, libre siya. These are promotional booths. Yung nandoon ka sa gitna ng mall or meron kang pwesto doon or sa hallway and you promote PhilHealth. Sinong gustong magpa-enroll? Yun po ang libre. Pero yung mga malalaking opisina, may bayad yun. It's in your budget.
Ang point ni Honorable Garin po, hindi po yung promotional booth nga, kundi yung opisina talaga. At any rate, Honorable Garin, maybe we can ask the board na kasama natin ngayon, na gawin na nila yung policy so that the executive can also follow. At wag na po magkaroon ng maging problema tong, because it's a very good suggestion na magamit talaga natin yung mga public offices for that. So, if we may have the commitment of the board to assist us on this as part of our cost-saving measure for PhilHealth. Yes, ma'am.
On my part, Mr. Chairman, naisip ko lang yung advantage of being in the mall. Kasi ngayon ko lang din naman narinig yan, being new in the board. Pero hindi kaya, gusto ko lang munang tignan the advantage of going to the mall. Kasi maraming tao dun sa mall. Kaya iniisip ko, it is accessible to people. Kaya baka yun ang reason.
Yeah.
Okay, ma'am.
At saka hindi rin lang, kung malayong office, hindi pupuntahan ng tao yon.
Okay,
Pero
ma'am.
kung sa mall doon, even churches now, they go to the mall.
Ma'am, let's do this,
Mr. Chair.
Parang
Ganito
yun
po.
lang yung nakikita ko lang I'm sorry.
Yes, madam. This is not the venue to debate on this. Pero yung point po ni Honorable Garin, pag-aralan po natin yan because ang intent natin is bawasan yung cost ng ating ng
Mr.
PhilHealth.
Chair.
So maybe if you can look at this as a policy because you are
Yeah.
part of the board. Honorable Garin?
Yeah. Mr. Chair, if I may, ma'am, tama po kayo na yung mall maganda siya kasi maraming tao. But we're talking about PhilHealth here. Yung transaction po ng PhilHealth, online yon. Kapag ikay empleyado, kinakaltasan yung sahod mo, nire-remit ng iyong employer papunta sa PhilHealth through the bank. Am I right? Pagka naman yung PhilHealth magbabayad, online naman, pinapadala naman dun sa account ng hospital or sa account ng mga clinics or doctors. In other words, the foot traffic, while it is high in malls, is not conducive for PhilHealth kasi wala naman talagang walk-in na nagpapa-enroll sa PhilHealth. Napakakonti. Yung mga nagpapa-enroll ng PhilHealth, either employee ka or grupo kayo, and if you look at the pros and cons, vis-a-vis the rental, doon, walang pumupunta ng PhilHealth na magpa-reimburse ng gastusin.
Honorable
You
Garin?
do it in the hospital.
Ma'am, Honorable Green, I don't think this is the time to debate on the rental policy of PhilHealth. You would have your own time in the board to discuss that. And Honorable Green, may I remind you of the time? Maybe we can go to the last question.
Thank you, Mr. Chair. My last question is this. Paulit-ulit po kasi, nung inaudit ang PhilHealth, paulit-ulit pong rason ng ginawa na ninakawan ko raw ng 10.6 billion ang PhilHealth at nilipat sa DOH. For the record, Mr. Chair, that is a big lie. But management during that time. Because the officers of PhilHealth told me na uubos ang pondo dahil hindi sila binabayaran ng DBM. So I went to DBM, very proud, asking for the payment. Nagagalit na nga ako, sabi ko, bayaran nyo yung PhilHealth. To my surprise, on the third meeting, para po akong binuhusan ng boiling water. Nanliit po ako at nahiya ako sa sarili ko. Because DBM told me front, ma'am, pwede ka naming makausap, wala kang mga kasama dito sa maliit na kwarto. And they showed me, gustuhin man naming bayaran yung sinasabing 10 points, malaki po yun I think 30 billion. Itong mga iba, hindi ito totoong miyembro. At ito yung pinapabayaran ng miyembro para i-justify yung 10.6 billion because it's there as a program fund. Laking gulat ko nung makita ko that the list of members there are existing members. Ibig sabihin, miyembro na, ginawa pa ulit na miyembro. Binago-bago lang yung mga pangalan. This is the worst thing. They carve out the names of the dependents of PhilHealth members. Ibig sabihin, kung si Congressman Mike Defensor, meron siyang akasawa, Mrs. Danica Fernandez, example lang po yan. Ay hindi, Defensor mag-asawa pala, dapat parehong apelyido, sorry. So, yung mag-asawa, meron yung mga anak. At yung mga anak, miyembro ng PhilHealth kasi anak nila. Kinuha yung mga pangalan ng mga anak o kinuha yung mga pangalan ng mga asawa at nire-enroll. Ano po ang direksyon nun? Gusto lang kunin ang pera sa DBM, but there will be no new enrollments, no new members, because they just want to get the money para pagtakpan yung mga nawawalang pera sa PhilHealth.
Honorable Galing.
And lastly, Mr. Chair, I would very much like to initiate again reforms in PhilHealth. So if the honorable officers of PhilHealth here can bring out all the reforms we did, put it back, do not deceive the members of the board, do not deceive the PhilHealth president. Dahil paulit-ulit po ito na nangyayari. This is worse than a pandemic. Because the pandemic comes every 100 years. Sa inyo, every time may bagong na-appoint, dinideceive nyo. Mr. Chair, I had two very important proposals to cleanse PhilHealth. And almost all of you here are aware of that. First, individual enrollment. Pagkapanganak, miyembro. Pag namatay, tanggal sa lista. Meron naman tayong National Statistic Authority Pwedeng mas mababa ang premium. That's why we incorporated that in the 2017 proposed budget. I was the one who defended the PhilHealth budget for 2017. Kaya yan lumaki. Because computed doon individual membership. When I left, they pretended it was forgotten. Kasi ang totoo lang, there is a study in PhilHealth, marami yung hindi enrolled. Kasi kapag ikaw ay minor at naging sobra ka na at 21 years old, natatanggal ka na dun sa membership ng magulang mo. Pagka ako ay member dahil dependent ako ng asawa ko, nawalan ng trabaho yung asawa ko, wala na rin akong membership. So let's do it individual para mawala yung mga pangalan dyan na hindi totoong tao. Or mga totoong tao pero ginawan ng pangalan 2 beses, 3 beses, 5 beses. Next, you have to outsource your legal office and your finance department should be independently seen. IT, yes, it has been always a problem, but most of it is intentional. When we tried to automate PhilHealth, kaliwat kanan na bugbog ang suntat-suntok ang natanggap ko. Bottom line is this. Since 2001, I was not yet in Congress. I stood up and fought against cataract fraud. citing the collusion between Philippine Postal Office and some officers of PhilHealth. Nagkaroon ng Seacrest report. It is a Bible indicating how fraud is being done. Unfortunately, all of the copies are missing up to this point of time. That study was commissioned by DOH in the early 2000s. Nagkaroon ng reforms noong 2004, nawala ulit, binalik yung reforms ng 2006, nawala ulit, binalik ng reforms ng 2014 and 15, nawala ulit. It will always be a repeated cycle. Talking about universal healthcare law, Mr. Chair, napakaganda ng batas na ito. But that will lead us to nowhere. If the people who has been continuously deceiving the minds of those who does not understand health financing, wala tayong mapupuntahan. Kaya ang tanong ko, Dr. Ish, you have been in PhilHealth for 21 years.
We have a curfew.
Yes, Mr. Chair. Did you ever do cash advance refund for Yolanda? Kasi yan ang palagi niyong reason. Okay.
May cash advance po ba sa Yolanda? Yung ginagawa natin ngayon sa
IRM.
COVID, sa IRM.
May IRM din po in 2013 for the Yolanda.
May cash advance po.
Ang sinasabi nyo kasi, nag-IRM kayo kasi ginagawa na yan dati pa. By the term alone, interim reimbursement mechanism. Cash advance is never a mode of payment in any insurance facility. It is not a mechanism of payment in PhilHealth. I am 2,000% sure of that. So ngayon, ba't nyo sinasabi na meron ng IRM dati? Nagkaroon ba ng precedence? Was there ever a cash advance released during calamities? Mr. Chair, I don't think we will get the right answers. I just do hope that we will all have the conscience to cleanse PhilHealth. I rest my case. Maraming salamat po.
Thank you, Honorable Garin. I think it's very clear yung pinopoint out nyo dun sa cash advance. Wala naman ganun. But it's called the IRM dati. But it was not a cash advance. So, we just have a manifestation from our members in Zoom. Our Deputy Speaker, Ferdy Hernandez, Deputy Speaker Hernandez is recognized. Nandiyan pa ho ba?
Yes, Mr. Chair.
Yes, go ahead, Deputy Speaker Hernandez.
Magandang gabi po, Mr. Chair. I would like to make a short manifestation. Because earlier during the hearing, medyo lumabas yung name ng SPMC, no? Yung Southern Philippines Medical Center. And parang it created an impression that it's getting preferential treatment. So may favoritism. At bakit yung SPMC located in Davao City, Region 11, nagkaroon ng isa sa pinakamalaking claims, no, sa PhilHealth. Parang lumalabas, napapaboran ito, and bakit SPMC is getting that amount compared to other hospitals that are popular in name. Siguro for the information of everyone, kailangan lang natin makorek yung impression that SPMC located in Davao at saka yung Tagum Medical in Tagum City are major hospital, government hospitals po to, no? Yung SPMC, I think it's one of the biggest government hospitals in the country. May bed capacity ito ng 1,500 and more than 3,600 ang personnel nito. And not only general hospital ito, marami ditong specialty healthcare services that they offer. No, meron ditong